Muy buenos días, señoras.
Good morning, ladies and gentlemen. Please sit down so that we can begin this session of the 5th Regional Conference on the Rights of Older Persons in Latin America and the Caribbean. We will be beginning in a few moments.
Buenos días. Buenos días a todas.
Good morning, everyone. Thank you very much for being on time. We will begin today's session with panel number 2, which is the promotion of health and well-being during old age, comprehensive health services and quality of life of older persons. So that will be moderated by Enrique Vega, head of the unit of healthy life of the Pan American Health Organization. And we will work until midday. So, Enrique, the panel is yours. Good morning, everyone. Thank you very much to the chair, to ECLAC, Celare, for the opportunity of being with you here today. For me, this is an extremely interesting experience. I was able to be in the first conference in 2003. And it is very important for me to be aware of everything that you have done so far. I have a difficult task ahead of me. I spoke with the panel. I have a panel of Cubans, Panamanians, Argentinians, and I am asked to be the timekeeper. That is practically mission impossible. But I at least will speak in Cuban, which is far faster than Spanish. So I would like to thank you all for the opportunity of focusing, of limiting ourselves to the time that we have available, which is 10 minutes per presenter, because I feel that what is important in this panel is to try to hold a discussion, to receive questions, answers from all countries about this issue of health. I have prepared a brief introduction. I hope you can see my presentation. And I will be very quick, especially so that countries and participants may take into consideration that we have not only done a lot. I don't know if you can show my presentation.
Bueno, mientras voy a tratar de adelantar.
Okay, I'll try and move ahead. I think we have to take into consideration in this panel that this region, the region of the Americas, has made fundamental progress in working with older persons. I am not going to repeat all the work that we have done in terms of rights and so on, but in terms of health, this was the first region of the world that was able to issue a resolution approved by ministers of health on healthy aging. I am still waiting for my presentation, thank you. And that was in 2002, as early as in 2002. That was the first region of the world which in 2009 had a plan of action on aging and health. The first region in the world as early as in 2009. And our work has been very intense. We have developed we have achieved many results, but fortunately, aging goes far quicker than our own work, as you well know, and simply dealing with the aging index, this region will have a large number of older persons. The number of older persons will be the same as children aged up to 15 years of age. I don't know what happened with my presentation. But this was something very important has happened with the epidemiological transition. I had a graph that shows how in the past 30 years, between 1990 and 2019, there has been a fundamental transition. Normally, we talk of the transition from transmissible to chronic diseases, but the most important epidemiological transition is that that illnesses are moved from the first to the second part of life. And most diseases in the region focuses on the second part of people's lives, primarily associated to aging. And that, in general terms, generates that the focus is far more on dependency rather than on death. So the biggest problem that we have today is the gap that exists between life expectancy and healthy life expectancy. Most countries of the region face a gap between life expectancy and healthy life expectancy, which is of practically 11 years. And that gap implies high levels of dependency, a high demand of long-term care, and so on and so forth. Within that context of what is most important, and we are presently at a very important point in this process, most countries in the region were extremely active in the approval of the decade of healthy aging. It was approved, as you well know, in August 2020 during the during the WHO assembly. But all countries, as the rest of the world, defined that we could no longer talk about health if we don't speak about a multi-sectorial approach.
And that is why it was decided that it was important that this process be considered from the interagency viewpoint. And so in December 2021, it was passed in the UN General Assembly on aging. To conclude, I would merely like to remind you of data that is important for today's work. This is by the World Bank. Countries have a life quality index that relates health, living with good health, and the absence of poverty. In fact, a relevant improvement over the last 20 years of this indicator of almost 40%, which implies 7 odd years more improved, but almost 90% of this improvement was in terms of poverty and almost nothing in terms of health. So yesterday we were talking about our concern with pensions. Well, a substantive improvement in terms of pensions, but an almost non-improvement or practically no improvement in regards to health over the last 20 years. In fact, there's been a worsening in terms of dependence. Of course, COVID, as has been said, this is a concept with which I will end, and that is important. WHS in 2015 determined healthy aging as essential in order to maintain your functional abilities. For the first time in the history of the World Health Organization, health was separated from illness. Today, you can be a healthy older person regardless of whether you have an illness or not. The illness does not determine that you are healthy or not. What determines it is the functional capacity. But this not has to do not only with the basic capacities for daily life, only attributes related to health that allow the person to be and do what they have reason to appreciate. And this is a transcendental, innovative concept that our countries must take into account. Based on this criteria and leaving all the rest to our panelists, it is for me a pleasure to recognize our first speaker, Carolina Gonzalez, has a licensed degree from the University of Buenos Aires as a master in human rights, the University of Alcalá de Henares in Spain. She also has a degree from the University of La Plata and is currently the Undersecretary of International Affairs and Federal Cooperation in the Ministry of Social Development of Argentina. Good morning, everyone, and thank you very much for the introduction. I will begin quickly because I understand we're short of time. I'm sure, Enrique, you will tell me when my time is soon to be up. First of all, I'd like to thank ECLAC and the entire technical teams for the invitation. Really, this was going to be mentioned by Victoria Sobrecapaz, who is unable to be with us on account of her agenda, and she is working hand in hand with the with the president of the country, Mr. Alberto Fernandez. But we wanted nevertheless to speak on account of the relevance of these topics for her. So my greetings on her behalf and my thanks to everyone, and also recognize the incredible work being done by the delegations and the technical teams and the members of the civil society with their contributions. I will try and be brief. Everything I had thought of saying, I'm going to turn them upside down, and also I will be changing my PPT. But the important thing is that we may leave here with experiences. We understand that the Argentine state has been making many efforts since Alberto Fernandez took up office in December 2019. First of all, facing the pandemic for 2 years, and then the impact of the war and everything that the region is going through in terms of poverty and economic situation, of which our country is, of course, not exempt. As you know, I will begin backwards. Picking up on something that Enrique says, I can share the panel with people who are specializing in these topics. I'm not really a specialist in this area, but the ministry, there is a specific area that in the purview of the Secretariat of Childhood and INAPAM, which is known to many here, the National Office for Policies for the Elderly, that has been making many efforts in everything related to pensions as well as this of moving towards an integral universal health service as proposed here. And based on what Enrique was saying, something that I'm sure you know even better than me, and that we side off health. What Enrique has said, and that international spheres and is included in different papers, but we must take ownership of the concept. They cannot be seen just as disease, but also thinking of health, of healthy aging in terms of thinking of our older persons, linked to a broader concept of physical, emotional, and mental well-being. And this in turn must result in public policies carried out by states. We must also take into account that often when we're speaking of well-being and quality of life in old age, as yesterday, we must think that these policies should foster not only autonomy, but older persons seen as the subjects of rights, not merely those who receive assistance. And they're not a homogeneous collective. There is a heterogeneity that we must pay attention to in terms of diversity, in terms of gender, in terms of territory. And that is not only in this region, but this happens within our states as such. And that is why when we carry out public policies that address older persons, the government has thought of this of working, especially on training in terms of gerontology, healthy aging, and for each worker who is in the public window, either public or private, is a window of the national, state, or subnational levels in order to address the specificities of the older person and may truly access service. We, this should be not just in writing and on paper, but this must truly be a reality for each worker, older person, uh, who will be near our parents. I would like to highlight in this sense, but from what we had prepared together, Alina Pam, the minister, some data. We know that Latin America and the Caribbean are going through a aging process of which Argentina is not exempt. We did a census last year, and the latest data from Argentina will be available this year. We're working with data on the last census in 2010, updated to 2013. Argentina has a projection of almost 8 million older persons, a very significant number, 16% of the total population. And in this way, we must also understand that Argentina, within this core of older persons, has a large number of women. Women that, in terms of life expectancy, is longer than for men, 81 for women, 74.9 for men. And so the state must know how to read this because aging occurs with a greater burden, mobility, and capacity, and with difficulties to economic security. And this is also, we must consider the pandemic and this condition the approach of our public policy. I would not like to avoid saying that this was constitutionally recognized, giving a constitutional hierarchy to the Inter-American Convention on the Protection of Human Rights of Older Persons, which already was in the law. But this gives us even greater empowerment to our policies for the older persons being carried out by our country. These are main three pillars in Argentina. One is pension coverage, the other is universal health service, and the other is the promotion of rights and policies for care. And here for each pillar, I had public policies to show you, but I know that the time is running short. But I would like to mention some data at least. It does not mean that in our country everything works well, quite clearly. We have difficulties and challenges that we share with the region, things that we have been working on and were mentioned yesterday. Today, pension coverage in Argentina is 97% of older persons. That is, it covers from 9 out of 10 older persons in the country, which implies that these persons have access to a medical coverage according to the pension system. And also under the government of Alberto Fernandez, we created pension mobility, which means that twice a year, in March as well as September, the pension amount is increased. Another thing that the government has done was to account for, in terms of care policies, that most times in this society where we live with so many differences in terms of gender, we were able to recognize these women that have done so much care at home, caring for children, and that have not been able to make their pension contributions and so do not have access to a decent pension. But we must recognize the contribution made by these women often at home. And also in terms of access to health, CAM, which is the National Social Security Services for pensioners, is the service with greater coverage of the older population in Argentina. 93.5% of older persons in Argentina are covered by PAMI, almost 5 million people. In this world of older persons, members, 63% are women, the rest are men. And I would like to say that, for example, this government in March 2020 presented a new vademecum of medications which are essential and free of charge. This is essential. Argentina has been able to extend the vademecum free of charge medications for most of the most frequent illnesses, but accompanied by a specific task in terms of empowering our older persons to recognize what they are taking, what their needs are, and that they should go against the abuse of medications. And so for us, this is relevant. Also, with regard to palliative care, I would like to highlight the work carried out by the INAPAN with the National Plan for the Training of Household Caregivers for Older Persons. And this, in addition to the creation of the Ministry of Diversity, Women and Gender, with very specific work focusing on older persons. And we have an interministerial panel with a specific approach to aging. But since I have so little time, I would like to say that I will share the example of potential care. Argentina is trying to create genuine work because there's always a lot of focus on assistance care. But this is a program that is addressing thousands of people. The idea is to train people so that they may have a trade and may join the labor work, and if not, further their education. So we enhance care with the almost 60 national universities active in the country. And so this is an agreement with universities and private institutions. So what is done as a service for these benefits is that they should train in palliative care for the older persons at our universities. These people do paid practice in the homes and working for the state or in private households. They obtain a degree. Then institutions must try and provide jobs. This is just to give you an example that the work must be done together. Civil society, as well as the state, as well as the market and the universities. And lastly, I would like to add, I'm picking up a book that I read recently, written by an advisor who works in our team, working with street children, children who live at home. It's called With Tenderness, We Will Succeed. Tenderness. This is so important. We understand that the state has an essential role to play to ensure rights. We need to put up the money in the budget. We should not forget of love. The state must, through its organizations, embrace older persons. And in turn, we must think of policies with regard to what Enrique was saying and without trying to take ownership of his ideas, but yes, interpret them. I would like to say that one fundamental right is to be able to project a decent life. Decent life should also be devised for these people who today could live much longer on account of everything that we have achieved as a society, but have a quality of life, feel useful, cared for, and embraced by all our older persons. Thank you.
Gracias, Carolina.
Thank you, Carolina. We will now go to our next panelist. He is Norbel Romangarita from Costa Rica, president of the board of the National Council of Older Persons. He's a neurologist, a geriatric neuroscientist, head of the neurosciences department of the Hospital San Juan de Dios, works in the Ministry of Health, and is president of the Alzheimer Association of Costa Rica. He's also president of the Alzheimer's Federation of Costa Rica. Norbel, you have 10 minutes. I am just setting my watch. Yes, so am I. I would like to greet you all from Costa Rica, remembering that the issue of aging is led by the President of the Republic, and therefore on behalf of President Rodrigo Chavez, I am speaking to you. The next slide, please. Costa Rica faces a kind of puzzle which involves 5 different pillars. It is a progressive construction over time, and certainly pieces that move over time because that is being modified, and we call that the 5 pillars for aging to achieve a decent old age. And this is a progressive development and is aligned with the Madrid route. I'll speak to you about the present situation, general description of the pillars, and I'll focus on the task that I have been giving. As you can see, we are experiencing a process of aging, a birth rate of 1.7 and is dropping to 1.6. And therefore, we face, like all of you, an aging index that will create problems for us if we don't take adequate action. We face the challenge that older persons are concentrated in certain areas in our small countries, but with the difficulty of providing access to better care in rural areas where we have the largest population, the largest vulnerable population. And as Enrique has clearly presented, we have the issue of dependency. And in my previous presentation, we spoke of very high percentages, and that is indeed a challenge. And this is the present snapshot, 5.6% of the population aged more than 60. We're talking of 500,000 inhabitants. Our total population is 5 million inhabitants, and that number is probably dropping. And we face this challenge, 3.1% of older persons, and this is a big problem, are not insured, and we need that 3.1%. And we must continue to work on this. Another challenge is that 27.6% of older persons living in poverty and extreme poverty, and the disability with a disability condition, 28% in general terms. But we know that in older persons aged more than 80, this percentage is higher. Our challenges, this is a snapshot of everyone, the cognitive deterioration. We have prevalence, functional deterioration, and so on. And therefore, these major geriatric syndromes distance us from what we call a satisfactory aging. And there you can see the list of which involves enemies of a decent old age. We must also take into consideration that progressively we have a greater use of resources by the health sector as a result of epidemiological cases, medicines, hospital care, and so on. And therefore, we go to the different pieces, to the fifth piece. One of the first elements of this construction is compliance with rights. And you can see the list there in the Constitution, the integral law for older persons, the law on abandonment, and so on. And you can find a fabulous instrument. We were the first country to ratify the convention. And that is what guides our work, the Inter-American Convention. Then we have strengthening housing, transfers, universal pensions, public transport, taxation burdens, human rights, equal opportunities, Convention of Disability, guaranteed autonomy, and the last one is community housing. Those are the tools, which means that we are here today, but tomorrow the country will continue to push ahead with this progressive construction of this puzzle. The other variable of this puzzle is cultural transformation, and therefore we're conducting a perception analysis. We have university agreements, national campaigns. We integrated the issue of old age in the curriculum of the Ministry of Public Education, the National Information Center, and the Consultative Council. Obviously, the construction of these tools, of these pieces of the puzzles, are not exempt from consultations. The other piece is the prevention and care for abuse, and therefore we have developed a national observatory, we have unified strategies, we have created awareness among the population, and we're saying, well, this is not normal. We cannot accept abandonment or any other expression of abuse, the dissemination of rights, and compliance with those rights. In terms of social protection, we are developing compliance with the National Aging Program. We have a policy of care which is under construction, the expansion of the program of solidarity links, the strengthening of the care network, and the expansion of a national unified system of knowledge in terms of where resources are, and we advance towards the national care network. And the last point is comprehensive health. We are developing successful models, promoting preservation policies of the blue zone before it becomes a light blue. We want the country to be in light blue, and therefore we have Cinca, the Alzheimer plan, which is under construction, the expansion of the model of services for the National Geriatric Center. And these are the partners, the daycare centers, and we work in this structure with partners. We have 76 long care centers, and this is a progressive development. This is also a fundamental aspect of what could be successful for everyone. The biggest successful model ratified by the WHO, which is the friendly cities and communities, which involve efforts by local governments. And we are visiting all local governments and mayors, and they all say, okay, yes, we are making progress. To date, we have 84 cities or municipalities, and we have tackled 29, and we must reach 84 in the remaining 3.5 years. In those cities, we have 4 or 5 axes: the issue of long-term care and health, education and work, urban development, and many areas of action that occur. For our next visit, we in Costa Rica hope to achieve to develop our activities. Perhaps we should meet before 5 years, and if that was to happen in 2024, I'll tell you that we have a Google map where we are able to determine the status of aging in our country and the actions and structures in each country, the domino effect, and this can be marvelous when it comes to all these actions. So we have 3 scenarios where we build structures and human resources at a state level, plus a unit of clinical memory, a tissue bank, molecular biology centers, and we also have solidarity families, community housing, a juridical consultation system, and through civil society, which is very important. Universities, training, carers, and professionals. Our country has a network structure which is universal, care is universal, and we have many centers where we provide services to our population. And at present, in this flow diagram, we can see care at a geriatric level. 217 geriatric centers represent, you can see what this represents in terms of older persons. And progressively, we have to make this accessible in areas that have face a bigger risk. And this is a scheme of how we view this. And therefore, we have increasingly more geriatrics, but we want them to be not only in the center of the country, but in those regions that are most vulnerable. I have 1 minute, so I'll say goodbye then. We have this map, we are building this, and these pieces will change undoubtedly. And therefore, you are a key piece of in each one of these parts. And so in 7 years' time, I would like to be able to convey to you the results that we have achieved. So thank you very much. Thank you, Norbert, for your presentation and for being on time. Now, Dr. Alberto Fernando Seco will take the floor. He's a specialist in general medicine, a master in social gerontology by the Autonomous University of Madrid, a specialist in the management of older persons for the Pan American Health Organization, has a diploma in public management, and has participated in national and international events, advisory groups, and so on and so forth. He has 26 years experience working on the issue of older persons, and since 2006 he's in charge of the National Department of Older Persons and Social Assistance and Mental Health of the Ministry of Public Health of Cuba, and is also vice president of the Medical Association of the Caribbean. Alberto, you have the floor. Good morning, everyone. I truly thank ECLAC. I have been coming here for more than 18 years. The previous team headed by Alicia Barcena, and now I have the privilege of knowing Simone Cecchini, and I thank her for her invitation. I have also once again met many people in ECLAC that we have encountered over the past years, and also civil society that is present with us here. For us, it is a privilege to share this event with you all. Cuba, the biggest island in the Caribbean, is characterized by a demographic situation that is characterized by a demographic transition with a very low level of birth rate. And we have suffered from this generational replacement, and less than one daughter or son per woman. That ensures this replacement. We have also experienced an accelerated aging. In 1981, 10.8% of the Cuban population was 60 years or older, and that has increased to 21.6% in 2021. However, the population of children was reduced by half in that same period. In other words, we have aged very quickly over the past 50 years. But we also have a high level of internal aging, with a significant increase in people older than 80. Among the population of older persons, totaling 18.2 in 2030, and we expect that it will reach 32.8% by 2050. With regards to legal framework and the policies on older persons, Cuba is undergoing a process of updating its economic and social model to ensure a fairer, more equitable, and inclusive society. It is moving along its sustainable development integrated by three dimensions: economic, social, and environmental dimension, and it suffers the consequences of the economic, trade, and financial blockade imposed by the US government for more than 60 years now, and its impact upon the economy and human society is the main obstacle for the development of the country.
Government priorities focus on continuing to further the integral development of human beings, as well as achieving economic development with equity and quality of life of the population. The affectations of health on account of the blockade in 2021 only in health ascended to more than $198 million. And this affectation accumulates more than $3,271,300,000. Despite the difficulties on account of the blockade, the country is working for the right conditions for older persons to enjoy the highest possible level of health. In 2019, Cuba passed the new constitution, Article 72 it ratifies that public health is a right of all persons and is the responsibility of the state to ensure access, free of charge service, and the quality of these services, protection and recovery provided. The state, in order to make this right effective, institutes the health system at all levels accessible to the population and carries out prevention and education programs to which both society and the families contribute so that these services are provided. In order to provide the health service, the country has 106,000 odd, we're talking of 94.9 physicians per 10,000 inhabitants. 100% of the population is covered, including in rural areas with a health picture with the prevalence of chronic non-communicable diseases, and as ratified by later data published by UNESCO, Cuba has a literacy rate of 99.75%. The budget assigned to public health and social security is 27% of the state budget and represents 11% of GDP. For the formation of the human resource, it has 13 universities and 29 schools of medical sciences, 4 schools of ophthalmology, 1 nursing, and we had an enrollment of 101,712, 6,899,000 foreigners in the country, and historically from more than 127 countries. This is the principle of Cuban health. This was born in Chile in 1960 with an intense earthquake, and then Argelia in 1963. We ascended with health professionals and older persons are in equal conditions in order to receive this collaboration. Despite the economic situation in the country, more than 60% of the basic medications are produced locally and contribute to other countries. Another guiding factors for older persons is the policy for respond to the demographic dynamics passed by the Council of Ministers in order to enhance fertility and respond to the needs of the older population and encourage the participation by older persons with jobs, especially those who are more apt to work. 7 subcommissions have been formed, represented by a minister, and these commissions are on migration, fertility, mortality, aging, labor resources, housing and human settlements, care system, which is a major challenge for the Cuban society today, and a productive technological response to aging. For the work of the Commission and meeting these aims, there are 56 measured and 74 themes and actions for the implementation. As the minister said recently at the Assembly, we've identified 11 themes that will be presented in the year 2023 at the Executive Committee of Ministers related to the presentation of the National System of Integral Care Life and the implementation of the services for the people. Another document of great value is the new family code passed by popular referendum in September 22, and that guarantees the greatest autonomy of older persons. The code recognizes the rights of grandparenting and the importance of interfamily communication. Another theme reflected here are institutions for the protection of older persons in cases of violence. Truly, the world was moved by COVID. For all countries, even Cuba, measures adopted for COVID-19 in our countries were carried out since 2020, before seeing the first cases in the country, which were in March that same year. And there was a strategy directed by the President of the Republic, the Prime Minister, and the Minister of Public Health, and the National Civil Defense Services in order to contain the risk of introduction and spread of the pandemic among the Cuban population. Measures were passed to contain the spread of the virus and mitigate the impact of the crisis and protect the population. Institutions in the long term found this as a challenge when we saw the news of what was occurring in other countries. An active survey was the essential tool to detect cases that began to be seen in all communities with an ample participation by primary health care workers, students, and university professors. One of the most novel achievements was the development of the fine potential vaccines against COVID-19. 3, Sovereign 1 and 2, Abdallah, and the last for those recovering from the disease. We had to create our own vaccine on account of the situation worldwide and in order to have medications. And another 2 vaccines, and Abdallah and Sovereign 3. This was the first country, Latin America and the Caribbean, number 30th worldwide, to receive authorization to begin clinical trials and human trials of a vaccine candidate against COVID-19, which meant that to date, we have 3 vaccines against COVID-19, all passed for emergency use by national regulatory services. At the end of the pandemic, Abdallah and Soberana showed a high levels of efficacy with 92.28% and 91.20%, respectively. Both today are among the top in the world. And so Cuba designed a vaccination technique based on science and its 3 fundamental pillars with guaranteed total coverage of the population with universal and scaled implementation. In the midst of this context, and not ignoring at any time the health of our people, they supported combating the pandemic, not only for us, but also the rest of the world. 41 countries that were assisted with 57 brigades to the more than 28,000 health professionals that were already working in different nations. They attended more than 500,000 patients and saved dozens of thousands of lives, including older persons. And also Venezuela, Vietnam, and Nicaragua received Cuban vaccines and helped by the Iranian Pasteur Institute, as well as Mexico and Argentina. And lastly, Cuba joined the decade of healthy aging with an initiative recognized by all institutions in order to improve the health conditions and in view of the aging of the population. And 10 years after the World Assembly, Cuba said, what's most human to be done by humanity is to care for our older people. Thank you. Muchas gracias. Thank you. Good morning. These are my first words to thank the government of Chile for holding this meeting. ECLAC CELADE for the invitation to take part as a panelist at this second pillar of the plan. I will begin my presentation with two citations. What opposes life is not death, but old age. The Romans extracted notion of person from theater. It was the mask that was carried by the tragic actor Giorgio Agamben, the Italian philosopher. The plan, or International Action Plan of Madrid, Article 15, I quote, says, it is indispensable to include the matter of aging to world programs. It is necessary to have an ample approach. The task to be carried out is to link aging to other frameworks of development. It mentions only two, social and economic. It just makes no mention of politics, nor civil, nor cultural, but yes, human rights. And concludes, albeit concrete policies are to vary in countries and regions, the aging of the population is a universal force and has so much power to shape the future as globalization. So the first question that arises is how to shape the future when all possibilities of being a person is closed. We know that the Madrid plan is not binding for governments and is an ambiguous signal in terms of public policy. We know this. But since our Guayaquil Declaration in 2016, the decade of healthy aging was brought forward and took up the need to build a thought with regard to aging. We cannot continue to accept that aging is a disease, nor As Simone de Beauvoir says, what is opposed to life? In our continent, the Latin American civil society has played a very important role. And in fact, in the decision was made to take it off the list. The group of WHO experts proposed old age as a cause of death. And so we are building a society equal to for all. But health must be part of this construct. We propose a health notion understood as rescuing the salvation of humanity that we all share. And in that sense, we see that fostering health as an individual responsibility, being able to decide what is good or bad. And we wonder, how can we have democracy? Thinking of aging without peace, or of total humanity, of anonymity, as Pablo Neruda said, the man who loved dogs. Speaking of salsa at the university, in the city of Panama, we see neither do we have support for the construction of proper old age. Responsible authorities see other priorities, but they do not see the construct of the persons as the foundation of these institutions. And this is a shame. Maybe we should just let them die in jail and masked with integral care to help them within four walls.
All this leads to the anguish that older people suffer from, this struggle for an uncertain, horrifying future, corruption, lack of transparency in terms of accountability, absurd wars that hinder the budgets of many people in Ukraine, in Yemen. And for many of us, it's even impossible to move our own legs, and even less so to open them so that we can perform physical exercise. Well, faced with such an outlook today, it's been 20 years since the Madrid Declaration and 40 since the Alma-Ata Declaration. And I want to refer to that because it's important to review what we said 40 years ago and what we still have to do. And what was mentioned at that time? If countries have to receive food, adequate nutrition, drinking water, maternal and children's care, the supply of essential medicines, vaccinations. However, no mention is made of aging or of old persons or of human rights, and therefore, since as somebody from the Ecuadorian network said, my colleague Alonso de Riobamba, he said, thank you, coronavirus. And thank you, coronavirus, because that virus has evidenced the tears of those that cry for the dead in Guayaquil, in Rome, or those infected by carers in old people's homes in France or Spain. And the pandemic has uncovered this indecency, as mentioned by my colleague Alexandra Casesha, this indecency, this hypocrisy of these vultures that feed on bodies and and uh, there is a quote that says where bodies are these vultures meet up, and most of the population today lacks water, sewage, caring for transmissible diseases, and non-transmissible diseases, maternal health, and so on. I don't want to insist on this. In other words, we don't find an approach focused on people, but rather focused on patients. And therefore, in Alma Ata, we have concluded that for those services to work adequately with the tenderness that has been requested here, and I would like to quote just one of the axes: to empower people and communities so that they may feel the owners of their own health, so that they can take on the role of architects of health and of the services that contribute towards that end. The Madrid plan says we need coordinated efforts in order to obtain and a concentrated approach. And we're here to see what has happened with this concentrated effort. And I have compared the three protection instruments that protect the rights of older persons that already exist: the European Declaration, the African Protocol, and the convention approved by the Organization of American States in Washington on June 15th, 2015. But to go back to the Madrid plan, was it in 2015? 2008, okay. Good health is the most valuable good that people have, but it is not the only one. Some $1 billion in a bank can also be a very valuable good. Isn't that true? And I leave aside the statistics that I share with you about life expectancy, and also reference to the other instruments. And I would like to conclude. Please don't get angry with me, Enrique, that we are not the old persons or the sick ones, or the architects of the society that venerates death without paying very little attention to those that are alive, to concrete life existence. So I would like to demand here that we halt the violation of human rights as a result of religious ideologies, supposed morality imposed by false charities, and a love, a supposed love that we don't need and that we also reject, that steals the rights, the role of rights taken on board by people. Morality is unable to determine that which Antonio Sancalzao Trinzao defines as spiritual damage to a person. That is irreparable. There is no way to resolve that. And likewise, we demand that we stop the unnecessary suffering imposed upon large masses of old persons. And this has been disguised as if we were victims. And of course, the solution are institutions, but we have seen that there is no possible reparation. One is always a victim, yesterday, today, and later. And of course, people would like us to look far better and more beautiful if we had our mouths closed. I want the government of Chile to again express a solidarity that was expressed with the strains, the wine strains that existed in France, because we know that that Chilean wine comes from those French strains. Very clear, Edilia, what you have said. Now I would like to invite my colleague, Ixchel Put, who is presently Executive Director of the National Council on Aging in Belize. She has specialized in the management of health of older persons by the Pan American Health Organization. She has been certified in social gerontology by the International Institute on Aging in Selima, Malta. And she has worked on the National Council on Aging since 2009 and has developed programs on aging, health, care, and programs to struggle against the abuse of older persons, and continues to advocate in favor of the rights of old persons.
Good morning. Thank you very much, Dr. Vega. I'd like to thank all our colleagues for the invitation to be here. It is a pleasure to be once again able to talk about aging and health from a Caribbean perspective. This morning, I want to run you through. It doesn't seem I can move. There we go. Very quickly, some of the challenges that our health system is facing in Belize, but also the way that we are addressing the aging of our population. On the screen, the first slide speaks very briefly about the National Council on Aging, the institution that I represent, which is housed within the Ministry of Human Development. And we are a policy unit brought to life through the Madrid International Plan of Action. In 2003, the council was established and its work is led by a board of directors. But to get right into our topic this morning, I want us to be able to look very quickly at some quick facts about the population and its aging in Belize. Now, we're a small country. We have about 430,000 persons estimated as of 2021. And out of that population, about 6 to 7% are actually older persons. We have an interesting demographic where we have more older men in the younger category, 13,000 older men across the country, but older women account for almost all of our older persons, 80 plus. And what I want you to pay attention to in the last portion of this slide is that although we have a coverage of about 10,000 persons on our national social security pension schemes, we have over 21,000 persons 65 and older who are registered to that scheme, which means in Belize, we do have a challenge with economic security and aging, which translates into how our population is able to access health and maintain well-being directly linked to their ability to purchase certain services. This population pyramid just highlights the shift that we're seeing. Although slow, we're definitely seeing our population change and grow as a Caribbean country. So, brief overview. When I talk about an older person in Belize, who am I referring to? Older women live longer than older men, as we have established, but we'll also notice that there are challenges where it comes to income security. Our national pension is estimated at a little over $250 a month, and older persons can apply for a non-contributory pension. It is not awarded universally, and that's only $50 a month. And then we have our Boost program, which provides $30 a month. But we also see that 48% of all our persons 60 and older account for some form of disability, and we only have about 150 older persons within institutional or residential care. So the care and support for our elderly is taking place within communities, through families, through access to the public health system. The Decade of Healthy Aging estimates that we are going to be experiencing 21.5 years of life post 60. So the average Belizean is looking to live about 81 years. And out of that, only 16.7 are years that are estimated of good health. So there is definitely need to address how we are aging as a population. This brief slide outlines where our public health institutions are across the country. And at this point, I want to note that there are no public health institutions that are dedicated specifically towards geriatric medicine, and we only have one mental health facility in the entire country. So there are huge gaps when we talk about geriatric medicine, when we talk about attention to older persons with dementia and cognitive decline. This map shows that there are 3 geriatric clinics which are run outside of the National Health Service. The first located in Belize City is the Mercy Care Clinic, which is our only geriatric facility run through our National Health Insurance Program, which is administered through our National Social Security Program. And NHI and Mercy Clinic provide geriatric care for approximately 3,000 older persons across the Belize district. They provide them with primary medical care, pharmaceuticals, social support through Meals on Wheels programs and nutritionists. And this has actually become a module that is up for replication in every district of the country within the next 10-year period. Then we have 2 smaller geriatric facilities, one run through our HelpAge Belize network, which benefits from the Cuban Brigade bilateral agreement and has the actual only geriatric doctor in the country, runs that clinic through HelpAge in 2 of their residential facilities. And then in Punta Gorda, we have 1 geriatric clinic run through Hillside that is manned by volunteer doctors who provide phase services throughout the year. Briefly looking at our health system, we do have challenges with nurses, doctors, and midwives. By total availability to our populace, it is something that we're still trying to address through the Ministry of Health. I just want to point out that we are still seeing as leading cause of death here, high rates for NCDs. If I know the graphic is a bit small, but we would see that in 2021, the leading cause, of course, COVID-19, followed by heart disease, followed by malignant neoplasmas, followed by diabetes. So there are challenges when it comes to chronic conditions and health in Belize. And we've also seen a spike come up for us with HIV. I'm trying to pull it. And this one will just bring into clear focus that our highest rate of mortality was seen among those Belizeans for COVID-19, 50 to 80 plus, those having comorbidities. And we've also seen within the HIV and AIDS spectrum a spike in older persons contracting the virus. And this has been linked mainly to lacking support and education of sexual health of older persons, which tends to be a taboo topic, speaking to older people about being safe in sexual practices. And then our NCD deaths, of course, the highest numbers we are seeing in the 60 plus category. So the brief look at NHI and Mercy Care. This requires a registration. No older person is turned away from a national health insurance facility. And although NHI is the only geriatric provider, other persons can access NHI clinics. And what they've started to do is through the Mercy Clinic program is be able to integrate slowly the geriatric protocols and checks. So persons who are NHI recipients who might have chronic conditions, who are not older persons, will receive telemedicine support, prompts for calling. But at Mercy Center, the older persons who visit this clinic receive all their primary health care, their lab work, their medication right on site. The Meals on Wheels program, where they have meals prepared for them specifically by nutritionists, and they have been able to see a 60% increase in the health and well-being of the older persons attending their clinic. And furthermore, a social worker placed at the clinic assists the older persons to being placed in communities or linked to other societies that provide for additional care. Now, HelpAge Belize has used their geriatric clinic to establish physical therapy services and centers within their community centers, reducing stigma of older persons who have mobility challenges or need to have assistive devices to come in and be able to receive services. So what we're seeing is that the social providers are finding a way to provide geriatric care and supplement it with the social support to improve the well-being of the older persons, but it also helps to build the resiliency of the families. Hope, which is in Punta Gorda, which is our southernmost district, also does Meals on Wheels and recreational services. All the older persons who are registered at Hope, and they have a population of a little over 350 older persons, receive free transportation, free medical checks, Meals on Wheels programs, movement to social programs to alleviate isolation. And we're seeing how these approaches to medical care improves the overall well-being of the older person. And my final slide, I don't think I will take my 10 minutes, Dr. Vega. My final slide is talking about the creation of resilient families. When we look at a population like Belize, a population that has more younger persons than older persons, a population where the older people are aging within the community, it becomes necessary to look at how do we build the resilience of the families who are taking care of these older persons. One, to safeguard the health of the older persons in their care. Two, to ensure that the families themselves will age in better health with better support. So the sandwich generation is real in Belize. Young working Belizeans who must care for children between the ages of 0 to 15 or 18 and are simultaneously caring for aging parents and family members who are around 60 to 80. And the economic burden, the burden of care, how do we build these things in so that these caregivers are able to meet these needs? Well, first we start to make sure that they have financial security. They're able to purchase and able to prepare for their retirement. Second, that they have permanent home ownership, that there are plans in place for them. And of course, through the rollout of programs like our NHI, Universal Health Care, that's being piloted by Ministry of Health, that they have access to the appropriate health care and the services that they need to manage care and providing further lifelong learning. In our experience in training caregivers and standardizing community caregivers, we find that while it is an economic opportunity for some, it is also a learning opportunity for families who are now stepping into a caregiving role and how they can provide care. So these are the 4 basic areas that we would look at, addressing the needs of that sandwich generation to ensure health and well-being of the older person as we age. Thank you for your time.
Thanks a lot, Chel, for your time. Yo creo que el panel, sin ponernos de acuerdo, hemos revisado de una manera muy comprensiva parte de los retos que significan trabajar en el desarrollo de un envejecimiento saludable. La década del envejecimiento, como ustedes saben, tiene 4 líneas estratégicas fundamentales que los países adoptaron como fundamentales para que esta década pueda cambiar y lograr una mejoría sustancial en la capacidad de las personas de envejecer saludable. La primera de esas estrategias
in a healthy manner. The first, which is cross-cutting, is how can we change the way that we think, feel, and act with regard to aging and old age. That is fundamental, especially not only in terms of how these older persons live, being the subject of rights, but also how do we fight and move ahead on the eradication or reduction and hopefully total eradication of discrimination on account of age. This is a fundamental factor in all societies in general, but most especially within health services and how health services reflect their approach to older persons. It is clear to everyone that discrimination on account of age is today the only socially accepted form of discrimination. It's not that the others are not present, always, but this one is still accepted socially. And we must all fight to build a formula in order to eradicate this. The second has to do with creating favorable environments for the development of older persons. This was mentioned here. Older persons need to continue developing their own processes. Many of our UN agencies have strategies in order to work on this from different approaches. But in fact, a healthy environment has to do with how we view the work of the social, economic, political, and cultural determinants that affect older people, and that through the aging process, they may, at the same time, fully develop their capacities. Several examples were given here regarding the relevance of working locally. So we foster not only development at local level, friendly communities and cities could be one way of addressing this, but there could be many more. What could be done at local level to ensure this process of development and guaranteeing these determinants that determine the possibilities of further development until the end of life? The third is the need to change the approach of our health systems and services. Here, we've seen that the results that we've achieved in 20 years and the results that we have not achieved in 20 years. But the aging processes, epidemiological transition and so on, have not stopped. And the challenge for these systems is essential, and it is not a quantitative challenge. This is important that we should discuss it. It is not a quantitative challenge. It's not a matter of having more physicians, more visiting rooms, or something like that. No, this is has to do with a different approach, how we focus our care for older people, primary health care especially, how we're treating these people. And within this search, I clarify the need and aspirations of older persons within that process. That is essential, that health systems should see this and understand it. Because today our physicians, they're still thinking of numbers, how many numbers you have in terms of glycemia or blood pressure or this or that or the other. But maybe they should be asking, what do you want to do? How can we help you do what you want to do with your health? And not so much that you have a high blood pressure and so on. And third and fourth, creating long-term human care systems. How to help these people who were unable to achieve that healthy ages and are dependent and require third parties in order to survive. And that is important. But it is a fundamental relationship between understanding what long-term care implies. And so many countries still want to see long-term care within a place under social protection or health. But in fact, long-term care is not health, it's not social, but a midpoint between these two areas, and they require of a comprehensive approach. Our countries must not only provide long-term care, they must also prevent people needing long-term care. We must work very intensely to achieve things in order to prevent the need for long-term care. But all of these strategies are based on 4 basic guarantees. One, to put older persons at the center of what we do, to be key protagonists in what is done. And second, leadership. We need people who understand the theme, that study, that move ahead, and that have leadership at local, national, regional level. We need to prepare our human resources. We need data and information. So with this, I believe this sums up the themes that were addressed in this panel. And so now I open up for Q&A, exchange of opinions, discussion in general. Over there, yes. Please give us your name. Argenia Duma de Barrios, Director of the Intergenerational University of the Universidad Santa María la Antigua, Panama. Alvaro Casares said that the 21st century revolution would not be of the proletariat, but of the encarecidos. And this is something that we will have to consider as older persons. 30 years ago, we began the foundation of the University for Work and the Elderly in Panama, and that we directed for 25 years. Now we are at the USMA for 6 years. We come to these meetings and we are grateful because you're able to make us visible. for a moment. And then we begin working ununited. But here we must materialize our unity. The vital cycle of the family begins at the wow stage when we love them and can't take our eyes off them. But then the last stage is seen to be death. But no, it is not. It is old age. And as I was saying on day one, what characterizes me is not my age, but my willingness to live and recognizing that nobody loves old people and that loneliness is eating them alive. Please, let's work together. What we need is that our voices and the unity that we're experiencing at this moment be seen and felt through what yesterday the director of Cuba, Teresa, said, continuous and permanent education. My doctoral studies researches what it is that is preventing us from moving away from the senility that is with us since the age of 35, but that we preserve here. We deteriorate. We're coming from a pandemic that has become endemic. Let's unite. Let's not do things alone. There are countries where the old people sleep under the sky of the heaven. Loneliness is eating us. It is corroding us. Please, let's unite so that each study be shared, because what we need are answers. We cannot wait any longer. These centers must be intergenerational. And when we have recovered respect, the respect of children for older persons, things will be different. That will be a rebirth. What we have allowed is for that to be taken away from us. We need constant education, more universities for old age, so that they may feel included, that they feel that they're able to still use their neurons. Thank you very much for this very good space. Thank you.
Por favor, vamos a lograr las intervenciones entre 1
Okay, we'll try to keep our interventions to 1 or 2 minutes to ensure greater participation. I don't know if there are any more questions, debates, discussions. Hi, good morning, everyone. My name is Alicia Ramos, and I'm the Secretary of the Citizens Observatory of San Bernardo. And I have the following opinion. I express my gratitude for all the things that I have heard today related to older persons. And with regards to the issue of health, I also feel that everything that is being said here is very appropriate in order to support older persons with regards to their future when it comes to health requirements. But with regards to the health of older persons, how do we get to this age and continue to be healthy? We have taken care of ourselves before this stage in our lives, and therefore I believe that the possibility of an older person to age in a healthy fashion doesn't begin when they are 60. It begins long before that, and a way to make future older persons more healthy is to conduct a prevention work as from when they're aged 30, and therefore government programs and health programs must begin with prevention at least at that stage. Thank you very much. Thank you, that is true. And we must have a life cycle approach, and 30 is late, in fact, and we must begin before people are of that age. Let's see. Romita, and after that, the other colleague, Adriana from Uruguay. Clearly, states are not monolithic in terms of public policies. Agendas at the level of international entities imply different work in different sectors, and those sectors have the ability to negotiate in a differentiated manner the government priorities, and how can you negotiate health policies whilst you negotiate other policy priorities related to the whole taxonomy of documents and international commitments
lucha de sentido por el envejecimiento.
that are permanently struggling when it comes to aging? Health is not a minor component because we're accustomed to we're encouraged to be useful and productive and useful and healthy. How are you able to resolve these processes that involve so much stress in terms of the different sectors of the state that generate budgets, resources, and actions that are truly effective? Let's see. I don't know if we're going to be able to resolve that. We try to do that. But the same thing happens to us in the UN system and in the interagency system.
Diferente. Yo creo que eso es complejo.
There are many different visions that is complex but enriching at the same time, to the extent that one opens up to debates and to differences and to transitions. For example, we're not only talking of state policies, but there are also changes at a government level that change the vision of how this is approached. I believe that at the end of the day, the achievement of general principles or basic ideas, clear ideas that may begin to use the model established by each country with the way in which they wish to approach this process can be helpful. But I don't think we have resolved this. We are permanently learning from this, at least most of us that work with these issues. One last colleague, please. Let's see. We are presently experiencing the World Cup, and in the past, the balls had 32 different segments, but our education is binary. I lose, I win, up or down, I approve or reject. At the end of the day, we have to create a multi-dimensional approach because our visions, which involve numbers, have we reached the target or not? And this world that seeks to compete rather than to share has to change. And ministries have to become true health ministries and not simply illness ministries. And therefore, we need intergenerational contact during people's complete life cycle. We don't need to worry about we need to learn how to invest as from the first day. And curiously enough, we find the need to market a product that is undervalued, and that is old age. We must value that, and we must develop continuous education in that sense, and reinforcing also the main ideas that you presented, Dr. Vega, with regards healthy aging. We must pay attention to nutrition as an antidote to disability, creating muscles, because health is a function. And if we don't perform that function, it becomes an illness or a dysfunction, and that can lead us to be defunct, to die. And the muscle is the engine for function, and therefore, if we're given the possibility of moving our bodies and our souls, we will reach a more connected world. A notebook without a Wi-Fi is simply a typewriter. If we don't have social contact, we are lost. Loneliness is terrible company, and to the extent that we work in our own compartments, we are lost. If we don't learn to share, I am Juan Carlos Molina, president of the Association of Healthy and Active Aging. This is the best way to conclude, Molina. So I don't know if anybody wishes to say something else, but we will bring our panel to a close here. Thank you very much for the opportunity. We thank the moderator, Enrique Vega, from PAHO, and the panelists, and we invite you to stay until 12:30, because now we will listen to the interventions by delegations so that you can talk about the issue of this panel. The delegate from Costa Rica is recognized. Well, yesterday we had asked for the floor. Can we speak now, Chair? Thank you very much. We are requesting participation in panel 3, if that's okay by you. Perfect, perfect. Very kind. No one else has asked for the floor. Are there any delegations that wish to share observations with regards to this panel discussion? Okay. Okay. Well, with that, we close this morning's session. We will now have a lunch break and we will resume at 2:30 for panel number 3. Thank you very much, everyone. We remind participants that we will very shortly, as from 1 p.m., be holding a parallel event in the Iglesias room at ECLAC, which is entitled Challenges to Demographic Changes in Rural Areas of Central America, Mexico, and the Spanish-speaking Caribbean in room Iglesias, located here in ECLAC.
Sí, ahí queda en 1. A ver si podía abrirlo de arriba. ¿No puedes? Ya.
Take your seats and we will begin this afternoon's session.
Muy buenas tardes. Muy buenas tardes, sí, agradecer.
Good afternoon. Please, can we take our places because we need to begin panel number 3. And for that, I would like to recognize Julia Ferre. Yes. So she can chair this panel. Good afternoon. Welcome to this third and last panel of the regional conference. It is the last session. We have all had lunch. We need to take a lot of sugar and coffee. My name is Julia Ferre. I work in the aging program of UN of New York. Firstly, I would like to thank the organizers for inviting us to chair this panel. And thus we can see the regional process in a more detailed way and follow-up of the Madrid plan. We will see the subject is physical, social, and cultural environments that strengthen the enforcement of rights. We have a panel meeting. We have our Minister of Social Development, our host, and please.
From the British Virgin Islands, Alice Ordóñez of the Office of Social Promotion of the Ministry of Health and Social Protection from Colombia, and from civil society, Adriana Rodríguez, coordinator for Uruguay of the Latin America Association of Community Gerontology. We are very interested in listening to the questions and the comments from the participants, both those who are personally as well as those who are online. So I beg you to please stick to 10 minutes. Around 8 minutes, I will make a signal so that you can start rounding up. So we will start with the first panelist, Giorgio Jackson, Minister of Social Development and Family Affairs of Chile. Will talk about the construction and implementation of comprehensive care systems. You have the floor, Minister. Thank you very much, Julia. I will try to stick to my 10 minutes. I'll put a stopwatch here. We wanted to tell you what is the vision that we have developed from the audit administration in order to walk towards a national care system that approaches in a comprehensive way. First, care. First, as a context, I believe we have already addressed that, so I will go very rapidly. First, we have that women who provide care today have a double or triple work, of course, unpaid due to the tasks they have to take on at home. We have a very high figure of single mother homes with heads of households who work, and also unipersonal homes of elderly. Also, the work of care, which is invisible in the economy. They say that 25% of the expanded GDP is accounted for by household work and care work. Life expectancy has grown in women 82 years and men 77, but it is on the rise. And the sexual division of labor is rigid and unequal. Also understanding that 85% of the persons who dedicate 8 or more hours to care are women. And at the same time, a greater demand of the middle sector to public institutions for care services. And the pandemic, each one of these factors started to increase, started to be unveiled, and the recovery in female labor and the different variables shown here has shown that in the economic recovery for women has been particularly slower in terms of going back to work again and recovering financial autonomy. We define a national care system to establish it on different pillars: the shared social responsibility of care, participation of the community in its governance, universality, local pertinence, community care, and data management, putting a focus on target population, in this case, childhood and adolescents, and persons with disability, and older persons with or without dependency. So structuring this in a graph, what we want is for these principles of shared social responsibility, integrality, and universality, integrate a system that includes care as a social right within a country, not as isolated services that may be not articulated. And so what has been built in social protection, and we want to towards a welfare state, one of the pillars of that new welfare state should be the national care system. The objective is social redistribution of the work of care and providing care. One has insufficient coverage, such as the care, which is always very demanding, and on the other hand, the invisibility of the social redistribution of care, which is something we want to emphasize, and we will show some of the things that we have been doing. Taking ECLAC's definition, we want to monitor a system of management and governance that permits taking the supply of programs that we have today, and that we have an intersectoral articulation generating a streamlining of care and public policies. Today, we have programs that respond to approximately 1.4% of the nation's GDP in terms of care. We can see 12 programs in boys, girls, and adolescents for the population at large, as well as for those who have disability or dependency. 5 programs for adults with disability and/or dependency. We have 8 programs for older persons divided between general old age or disability or dependency, 12 for general population with disability and/or dependence, and 1 for the caretakers. We are talking in general of a budget that in Chilean pesos is 970 billion. What is spent in $1 million would be something like $1 billion, a little more, 1 point something billion. And so that is equivalent to 1.4% of the budget of the nation. And of course, moving towards the national system of care requires a major expansion of expenditure that must be defined progressively. These programs come from different ministries. The Ministry of Social Development and Family Affairs has some, but we have many others depending on health, school, depending on the Ministry of Education, others from the Ministry of Women and Labor Equity, and also from the Ministry of Labor. So the challenge of grouping the supply is no minor issue, thinking in organizational terms, and the challenge that getting different ministries, different working teams to agree. When they get together, there's all sorts of problems, practical problems, but also trade-related problems and other issues that need to be addressed from the start to organize the supply and provide better care to our population. The roadmap. Today, we have 28 new districts in the network of care, and now we have a total of 90. The hospices, we are committed to the two regions that we need to get these hospices, which are Tarapacá and Ñuble. Also, the day care centers that we want to focus, particularly active aging, the day centers for the elderly. We've added 56 or 53, 57 in all, 57 centers for the elderly, for older persons. It's a little more than 165 at a national level. The coming weeks, we will go to Magallanes with the regional government for a pilot on care and community services and the platform I Care for Myself and I Care for You. Last week, we had some training so that the caretakers can have networks for care for them. But the persons working in those networks should have a support network themselves. And also the project on dignified, active, and healthy aging, apart from the credential of the caretakers that I will address in a minute, and the pensions reform that gives more dignity to older persons with this universal guaranteed pension that we want to increase to $280 per month for every person older than 65 in our country. The module of care that I mentioned is a complement to the social household registry, which is the initiative that we use for public policies in our country. It's the most complete database the state has, which permits incorporating a person who is a caretaker and added with the diet that is with the person who is receiving the care, and so provide certain benefits such as, first of all, preferential care in public institutions, recognize the work of the persons who do that, make that work visible, and to ensure that those persons who will be caretakers can have other levels of support. One could think, for example, priorities to access housing, priorities to eventually in the health, the waiting list, health Ministry of Health working waiting list, and other related ones. I'm taking a bit too long. Working plan. The working plan 2023 that will start in just a few days. We have the creation of the National Policy of Care as our commitment, the implementation and function of the Advisory Council and Technical Secretariat in terms of care. We signed a decree for that interministerial council, the development of social dialogue that will permit reaching a conclusion that will serve as a basis for the draft bill that we want to present, which is the framework law for care by the end of the year, and 2024 processing that law, and at the same time the design and presentation or the expansion of the new supply of programs. This year we will advance in the consolidation of a budget that was included in the different services. Now they're grouped together, and in a proposal for 2020 that was approved for 2023, and the line is social development. There's one line which is national system of care. We were able to group the supply in accounting terms so as to advance in the coming years. And as Horizon and we will make the work of care very visible. You cannot imagine how important that is. The mere fact that persons can know that they have a credential that will be recognized changes the dynamic. It empowers them to subsequently move towards the recognition of other rights. We will also continue with the work of articulation of the program supply and the increase in coverage. We cannot increase it in everyone, in each one of the programs, but we're trying to get an increase and go into a caretaking state with a gender perspective, because the comprehensive care system cannot but have a gender perspective, and we want to move towards a society of care with the creation of a national system of care that will organize the existing supply and articulate the work that we want to take place in the future. It's 10 minutes and 10 seconds. Thank you. It's going to be a challenge for the rest of the panelists. Thank you for the presentation. And considering all the countries that talked about the importance of the systems of care, it's a very valuable topic for all. When we talk about the caretakers, we have to remember that many older persons are caretakers themselves. In my country of origin in Spain, there's many people who wouldn't be able to work if it wasn't because their parents are caring for their children. I'd like to give the floor to Marlon Penn, Minister of Health and Social Development of BVI, who will cover the protection of human rights of older persons vis-a-vis disasters.
Thank you, Julia, and I promise you that my PSs have been very scripted, so I'll stay on message and stay on time. Firstly, I would like to thank ECLAC for the opportunity to participate in this important discussion and share the Virgin's perspective on the topic protection of human rights of older persons in situations of social and environmental disasters. Vulnerability is a human dimension of disasters, and many older people are especially vulnerable because of the decreased mobility, chronic health conditions, and lack of social support. This makes it harder for them to maintain their homes, prepare for a potential disaster, receive and act on early warnings, and evacuate or otherwise protect themselves. The Caribbean has the fastest aging population in the development world. According to the Pan American Health Organization, population aging combined with climate change and a growing number of intensity of disasters creates special challenges for a region. On September 6, 2017, Hurricane Irma hit the Virgin Islands. Many tornadoes formed inside the cyclone and gusts in excess of 220 miles per hour were measured. This crisis happened just on the month after the territory had experienced extensive flood damage, and 2 weeks before being struck by another Category 5 hurricane, Maria. The lives and well-being of older people were severely affected by the widespread devastation, especially those who were displaced from their homes. Disruptions to healthcare and social services, transportation and communication, utilities and food supply, along with the psychological impacts, were also far-reaching and long-lasting. Although only 4 persons died during the passage of Hurricane Irma, it's not surprising that we recorded a spike in the number of deaths in the following months, mainly among older persons. Protecting the elderly was therefore central to the government's response in areas such as social protection, housing, health and nutrition, and psychosocial support. Following a door-to-door rapid assessment, expansion of emergency sheltering, and the distribution of food and relief supplies, attention rapidly shifted to the disaster recovery phase. In conducting social assessments and enrolling beneficiaries, the presence of older persons increased the vulnerability score, and the level of priority given to eligible households that received 3-month cash grants and housing assistance. A financial assistance program was delivered jointly with the BVI Red Cross and the Social Development Department, using a shared beneficiary list and a joint cash platform. The program directly served 3,274 individuals, including 289 older adults. Housing. In the aftermath of the 2017 disasters, nearly 50% of the country's residential buildings suffered major damages or were destroyed. Replenishing the housing stock was therefore central to the territory's continued recovery. Throughout this housing recovery assistance program, eligible households were given grants or soft loans to repair damaged homes or construct new ones. Out of 649 applicants, 357 or 55% were aged 60 or older. Healthcare and social care. Interruptions to the healthcare services and access to the medications especially affected older persons. This was mainly due to the physical damage to several community clinics, as well as disruptions to transportation and utility services that limited the movement of healthcare workers and medical supplies to the islands. In response, BVI Health Services Authority rapidly reorganized its priority care services. Makeshift clinics were set up, and the home visiting program was expanded. More recently, a modular field hospital was acquired to increase the capacity of the health system to respond to future disasters on multiple islands. Additionally, an initiative called Strengthening Mental Health and Psychosocial Support in Disaster Management and Building Individuals and Community Resilience was implemented, which has trained more than 200 persons throughout the territory. The project was later extended in the response to COVID-19. The disasters also affected older persons in residential care settings. The government's 2 homes for elderly suffered extensive damage during the storms. Along with rapid repairs, both facilities were expanded and upgraded to increase resiliency to future disasters. Several community centers and churches were also severely damaged or used to house displaced persons or extended for extended periods. As a result, recreational day programs that provided leisure and social inclusion activities for older persons remained closed for extended period. Even as community centers were being repaired, seniors' recreational programs were further affected by the COVID-19 social distancing safety measures. The Social Development Department maintains a disaster risk register of older persons. This tool helps in assessing and understanding their needs, building resilience, and providing assistance when needed. It is imperative that countries find ways to support older persons' resilience, preparedness, and recovery from disasters. This approach needs to be built into government-led comprehensive disaster management strategies, underpinned by a shock-responsive social protection system. Governments and its social partners need to work together to 1, strengthen institutional capacity to mainstream and respond to the needs of older persons in emergency or disaster situations. 2, support representation of older persons and disaster management teams at the community level. 3, encourage NGOs to assist with safeguarding the well-being, including evacuation of older people in times of disaster. 4, minimize disruption to the health and social services on which older people rely. 5, design shelters that are accessible for older persons. 6, create contact systems to enable checks on the well-being of older adults. 7, use community mapping data to identify areas where many old adults live. 8, bolster social support across individuals, families, and communities at large. And 9, provide financial resources for older adults who do not have the funds to manage pre- and post-disaster expenses. Looking ahead, the Virgin Islands' response to disasters of 2017 has shown what can be delivered to meet the needs of older people if social protection is properly resourced and when a range of actors work together. The government of the Virgin Islands has therefore renewed its commitment to support strengthened disaster risk management and social protection systems, including through enhanced arrangements for disaster risk financing, ensuring that resources are channeled towards developing an age-friendly approach to disaster risk reduction will help mitigate economic, health, and other insecurities for older persons in the future. This thus concludes my presentation, and I once again thank you for the opportunity to share the Virgin Islands perspective on this topic and look forward for the discourse later on in the proceedings. Thank you.
Yeah, 8 minutes. Thank you so much for your intervention and for bringing up the discussion on the issue of emergencies and the impact they have on older persons. My team worked a while ago on the issue of emergencies, and we were shocked to realize how overlooked older persons are in emergency responses. So it's really encouraging to see that a country is undertaking targeted actions for older persons, like the disaster risk register for older persons. And I also could not agree with you more that it's crucial to support the representation of organization of older persons in discussion around disaster management. Vamos a escuchar ahora a Alex Ordóñez, jefe de la Oficina de Promoción Social del Ministerio de Salud y Protección Social de Colombia. Señor Ordóñez, tiene la palabra.
Muchas gracias. Muy buenas tardes nuevamente. En primer lugar, agradecemos esta invitación para participar en este panel de cierre. Para Colombia, sin lugar a dudas, es muy importante poner en contexto de lo público el marco situacional de las violencias contra las personas mayores en el país, para tomar decisiones desde los enfoques de prevención de las violencias y promoción de la vida y de la salud pública. La presentación que vamos a hacer, básicamente, digamos, tiene 3 puntos esenciales. El primero es las violencias contra las personas mayores de 60 años en el país. Ok. Entonces les decía que el primer punto hace referencia a las violencias contra las personas mayores de 60 años. El segundo hace referencia a la respuesta institucional desde la política pública nacional de envejecimiento y vejez que lanzamos este año. Y el tercero, comentaremos algunos retos y desafíos para la implementación de esta política pública. En relación con el análisis de las violencias contra las personas mayores, vale la pena mencionar que es necesario avanzar en el fortalecimiento de los sistemas.
Move forward in strengthening information systems, and with that we have a context close to violence. For example, there is lack of information in real time. There is under-registration of problems of the population. Indeed, according to the registries of the external non-lethal causes of the Ministry of the Forensic Institution for 2021, 51,600 evaluations for cases of violence were made. Interpersonal violence, sexual intrafamily against older persons. There was a trend to the increase in this type of violence in this last 7 years. The rate of cases per 100,000 inhabitants in yellow went from 132 in 2015 to 141 in 2019. In the years 2020, 2021, we observed a decrease that probably it is explained due to lockdown in view of COVID-19 pandemic. And there has been, when analyzing this phenomenon, jointly grouping the different forms of violence, we can infer a greater impact on persons, older persons, male. They received 54% more evaluations for these violence than female. And the rate per cases per 100,000 went from 177 in 2015 to 189 in 2020 in the case of men, and from 94 to 102 in the case of women. We highlight that Colombia, as it is a diverse population and territorially a diverse country, we have been able to identify differences between different departments or regions in going over intra-family domestic violence against people over 60. We can see some additional aspects. First, this specific type of violence, that is intra-family domestic violence, accounts for 26% of the total of cases of violence. That is 1/4 of all the types of violence against older people is precisely intra-family domestic violence. The trend is similar to the previous one, a sustained increase of registered cases, as you have the rate per 100,000 inhabitants that went from 30 to 36 in 2018. This type of violence is accentuated in women, that given that 63% of cases, the victims are women over 60, and this coincides with the violence of women in last stages of life. It is striking that 62% of victims of these violence are between 60 and 70 years of age. This situation and this information vis-a-vis non-fatal external cause violence with information collected this year from January to October, we identified that alarmingly boys, the sons are one of the 42% of its the aggressor is the son. And therefore, in those situations, 40% of cases were related to activities of care of older persons and 27% in activities of the home. That is, that conversely to what we can think, care activities and home activities are not safe for the protection of the rights of older people. There is as to a factor that triggers violence, there are two things: intolerance, male chauvinism, that in Colombia have generated 65% of physical violence. And secondly, the consumption of alcohol, that was 24%, accounted for 24% of cases. It is striking that the scenario where the non-fatal lesions occur, 84% occur in the houses themselves where older people live. So we need to strengthen violence prevention actions, the coexisting measures and supportive measures. I want to say that in updating the national aging policy, this has been a very important exercise for the country, reaffirming citizen participation in the organizations of older persons and the need of articulating the response of the state. Thus, we can mention as an achievement for the country that in May of this year, for the first time in the history of older persons, there is a national policy through Decree 681 in order to give a permanent and binding nature to the commitments derived from its implementation. One of the elements to underscore is the participation of older people in the formulation of the action plan that we are now implementing. This participatory approach is an effective way of eliminating discrimination against older persons. The work we are doing has had the participation of civil society, the Council of Elderly, the Council of Territorial Communities, scientific societies, academia, NGOs, and in the national government, 13 ministries and 3 administrative departments. We need to increase articulated work, the articulation of all, but we are preparing a joint participation between civil society and the national government, an action plan that will collect all the needs of territories. It is important to mention also that the above, supported by the political will of the new government, had an evident effect. Colombia was the 9th country in ratifying the Inter-American Convention of the Rights of Persons in the OAS, and this was done on September 27th. And this is a binding document for the protection of the rights of the seniors. And this gives a different view of how the government is thinking and building for older people. And this policy was based on 6 strategic axes.
The first is separation from economic dependency. The second refers to social inclusion. The first to a free library of violence, for comprehensive health care, attention to dependency and organization of care. 5, healthy aging, and the 6, education, training, and research. In terms of the way that Colombia proposes to approach violence from politics, but we have identified, we bring it as a proposal, is to approach it as a cross-cutting issue regarding population policies. And this leads to a social construct that starts by identifying the causes of violence that we have already identified, that prevails in patriarchal contexts, which are still valid and affect the households, and promotes subordination, economic and physical dependence in many cases. We have identified very forcefully discrimination and violence, and on a negative review of old age and disease. And particularly when we talk about domestic violence against older persons, that they affect the mental and physical health. I was commenting yesterday in the country report about the care for neuropsychiatric disorders in Colombia are on the rise in the recent years, and also affect public health and generate damage and risk for other disorders. I will conclude with the last part. Then, because of time constraints, as to the challenges for implementation, we consider very important strategic aspects. To first put in the public agenda and available to the society at large this phenomenon that takes place and is on the rise. Second, there is a reform to health that within the agenda of the new administration involves several aspects, reinforcing the mechanisms to face the situation under a territorial approach and under a rights-based approach. Now, it's important to acknowledge that even though it's the Ministry of Health that leads the issue of policies, we need articulated work. And finally, at all times, we must have the participation of older persons in the processes of formulation and implementation of the public policies. I would like to end up by saying that for the new administration in Colombia, it's very important to have a recognition of the social struggles. So we ratify, we want to be part of the steering committee of the fifth conference. We believe it is important to build for and with older persons. Thank you very much for sharing Colombia's experience. And I feel sad, but I'm not surprised when you talk about the problem of under registry, because the violence against older persons at a global level, the incidence is high, but it's just one of many crimes against older persons without any social visibility. One must bring up much more visibility, as you said. I would now like to give the floor to Mrs. Adriana Rovira, coordinator for Uruguay of the Latin America Association of Community Gerontology and focal point for the working group of older persons of the panel of follow-up of the 2030 agenda, who will also talk about discrimination and violence. Thank you. There is a presentation. When they put it up, I wanted to thank ECLAC for the invitation to participate from this panel, and also thank for the efforts and the commitment made by the government of Chile as well as ECLAC to have the voice of older persons and civil society represented in each one of the panels. We need to highlight that, which I consider to be fundamental. I need to present some guidelines of civil society. And at the start, I'd like to pay homage to all my colleagues from civil society who accompany the process of fight in the region. They accompany the older persons as well. And that homage, we'd like to recall Elsa Shred, a friend and social militant for the rights of the older persons. We lost her very recently this year, just a couple months ago. So my loving memory for her and my presentation is a tribute to her. Trying to stick to our time, I would like to show some categories. I will not go very deeply in the issue of discrimination and violence, because I will try to show some problems related to discrimination to older persons. There is a question which is key, which is when does the world start to detect this demographic growth of older persons? Why does this happen in the world? Why, or in what historical moment is the issue of aging of our society brought up to the table? I believe those 2 points are key to understand the current context in which we are in the region and in the world. Because why this topic is still lagging behind and why this issue must be dealt with urgently. Clearly, we cannot limit violence to older persons only because we live in violent societies, violent world, and the most violent continent in the world. So clearly, our processes, our course of life is traversed by different types of violence that frame, that shape, and which affect the way that we perceive ourselves and other persons and how we negotiate which which lives are important in this world and which lives we will discard along the way, but only when they grow old. But throughout the process of the course of existence, we're constantly having ethic and moral agreements as to who need to be collectively protected and who are not. I believe this point is key and needs to be thought. When does old age become a problem? When does it become a social event? Here we have a Chilean anthropologist, Josiel Moya, who has been working in this thesis presented by the governmental studies from Foucault, and he says that age is an unexpected event. Modern society intervenes and manages life to improve the quality of that life. We didn't think that aging would be the result of the improvement of the way we live. Aging is a consequence of that, but not only aging for those dominant classes that manage to improve the quality of life because of access to potable water, fertility controls, etc., but that also is distributed throughout the sectors that are disenfranchised, that who are benefited in their lives. So we face a world that not only ages, but many groups of persons age in the situation of high social discrimination and precarious living conditions, where life is like a punishment in old age. It's not just demands, but there's many persons where reaching old age, when they are displaced, when they are migrants, or political persecution, lack of resources, lack of food and basic resources, transforms that life in a sort of conviction. When is old age brought up to the table? That's important to think about it. It starts in the decade of the 70s with the increase of neoliberalism, the reforms by Margaret Thatcher and Ronald Reagan that start with the financial crisis of the states and fundamentally linked to a war. And this must put us in alert because once again, we are facing a new war that somehow goes across the West because wars form part of our existence. But this war against Vietnam that puts the US with a big fiscal deficit starts to affect the social security and health costs in the US. And it's important to go over that. It's important to put them up for discussion. So we live in a world where old age is affected, when reaching old age is questioned, and there's permanent processes of discrimination. Discrimination and prejudice against age. One thing is the stereotypes. Sandra Wenchan has worked on this brilliantly, so I will not repeat what she has said in the development. But when we talk about discrimination, it's not just the bias of age. These are actions that are systematic, that are intended to not permit persons to access rights that they are entitled to, put obstacles so that the older persons are also persons. It seems like a very ridiculous exercise for me to bring it up, but very often we forget about it in the moral agreements. Important, they want to keep them from attaining all the mechanisms of protection they need. Oppression is also related to discrimination. All older persons discriminated the same? They're not. And there I will quote an anthropologist, Didier Facen, who has been working on this topic. And he talks about a study related to 3 genocides where they appropriate the concept of age to look for elements of protection of rights. For example, Augusto Pinochet, he managed to escape trial by claiming he was old. Didier Facen works with this example jointly with 2 more. How age is used as a game, sometimes used for the recognition of rights. Not all older persons suffer the same process of discrimination relating to age, because the process of discrimination articulated with structural elements of the life course. It depends on who I am, where I live. It depends on what aspects of social welfare I can access during my life, or social well-being, that is, where I'm born, what continent, and what place. If we start to see the population has a life expectancy with a gap of 10 years per continent. In Europe, life expectancy as an average is 80, Latin America 70, and Africa 60 as an average. This somehow shows us that there are structural gaps. As I said at the start of my presentation, old age deals with the intervention and the way you manage life course. If the state does so in an adequate way, that increases life expectancy. If the life course takes place under critical conditions where the way life is dealt with is without access to basic needs, that shortens life expectancy. So there are population groups that are not discriminated in equal way. In fact, they are confronted by other populations, like who have the resources, the power to make decisions. So when we think about discrimination, we must also see these boundaries. Not all older persons are in equal conditions, even in view of the negative aspects that we build socially. I only have 2 minutes. I will try to sum up. Very rapidly, how does neoliberal capitalism work in terms of oppression of old age? Permanently, we negotiate this, the value of life, the motto linked to leaving no one behind. We should make it a reality because we constantly leave people behind who cannot climb the bandwagon of development. There are two aspects that give value to life related to this capitalistic neoliberal model. That life be useful in two frameworks. One that's related to Judith Butler and the queer theory, and that I would love to take Lee Edelman. That the capacity that life has to produce life in order to be exploited. What does it mean? Reproductive life. A life is worth if that life can produce new life to be exploited. So when we talk about the demographics and birth rates, what are we discussing? Many boys and girls are constantly born in our continent. Why do we need to stimulate fertility so that what kind of boys and girls be born? How are we going to distribute social well-being with the migrant children who cross on their own all of Latin America to get to the US? Who cares about those children who are also born in our continent? So shouldn't we ensure that the distribution of well-being reaches the children who are born in conditions where life will not develop?
En contra de la interrupción.
Why are we against voluntary interruption of pregnancy? When is life important? When it is in the body of the woman, but then it's no longer important. It's an ethical debate. And the other component that is that life is useful to generate capital, and that capital is not distributed equally. And there, as you were saying, in the different spaces, that life that is exploited has impacts in the body, and in that life, who takes control of the exploited, dismissed life? Are we going to take care of those bodies that are left out of the road? No. Those two elements, those two dimensions are key to think what lives are important. Old age is out of those, it's not productive, it's not reproductive. Loses usefulness for neoliberal capitalism. What do we do? There is a key element. I want to convey the concept of a North American philosopher who died last year, Lauren Berlin. The exhaustion of the management of the vital, the processes course, a key element, that is the dismantling of the political. If I have to manage the risk of being alive, I get up in the morning, I see how am I going to be alive until the end of the day. There is no space for political action, for education, for reviewing, for civic participation, and see what my rights are. I just am concerned about keeping alive. So the lack of social well-being, and really it's the old age are taking away from the possibility of generating a review process with a voice and saying, what societies do you want? What places are going to be taken in that society by older persons and by all the frameworks of well-being and rights? Thank you. You've brought up so many subjects. You've referred to heterogeneity of seniors and life cycle. I live in the US, and in the US, the president is an older person. We need to be careful of speaking of older persons as if it were a static homogeneous group. It is a heterogeneous group. So with this, we have finished the panel presentations. Thank you for Thank you. Just thanking the chair of Julia. We will give her an applause for having chaired this meeting and the comments between one and another presentation. We'll have time now for countries to present their ideas. You can raise or ask for the floor. Country interventions. Costa Rica, you had requested the floor. Cuba, and there in the back, yes, from civil society, right. 3. Only 3 minutes per intervention, please. Thank you. We've spoken about social development, about health, about education. In fact, Costa Rica also, like Chile, has certifications. We have, yes, violence, discrimination of age, just like Colombia has presented. We have structural gaps as was presented by the civil society. I will now refer to the work of well-being, social inclusion, science, technology, digital gap, citizen security, culture, public works, transportation within the framework of this creation of environments that favor the rights. These strategies to create environments for these rights involve the interinstitutional and intersectoral approach where you can integrally work on those deficits of public offer. When there is public offer, what do you mean? There are deficits in the educational system. There is a lack of sources of work, of houses, housing, as elements contributing to vulnerability and insecurity of all communities. Without an integral approach strategy that or targeting the effects or causes of systematic crime in vulnerable communities. Without that, you cannot guarantee a decline in the occurrence of crimes or homicides, nor the enforcement of rights in a safe environment. The state intervention shouldn't be done only through police repression forces, but rather based on an intersectoral preventive strategy. In Costa Rica, we have created civic centers for peace, a program with cultural content designed to prevent crime and creating safe environments. It's important that the efforts of programs that are implemented or financed by the state to have a groundwork knowledge, a ground root knowledge of the needs and program and taking into account all elements to ensure the greatest impact possible and hopefully the benefit of all the inhabitants. I will close, particularly those, the seniors have valuable knowledge that make up the cultural, gastronomic, artistic identity of the community. I can speak about the ceviche of my father or another meal of my mother. These elements can be leveraged to generate opportunities for labor, for entrepreneurship, for generation of income in an exercise that will make visible and will serve the local cultural heat. Thank you. Thank you to the delegate of Costa Rica, now delegate of Cuba, and then civil society. So as to continue afterwards with Argentina. Yes, thank you. First, acknowledge the quality of presentations in such transcendental topics as well as the work of the chair. When a Latin American says, I'm going to be brief, or a Cuban says that, you need to stop. We'll never be brief. I want to convey one idea. Yes, one idea. Of all these subjects, I want to refer to integral care system. Very often has been said it is vital, decisive for our countries. We have seen the experience of Chile, also the experience of, well, I will not refer to that of my country. It is a complex process. And we need to learn, as I said day before yesterday, from all of us, because some experiences are not that feasible or sustainable in our countries. But I will refer to a macroeconomic exercise that we conducted in our office with research institutions on the economic cost of care. First, there's gender inequity because these are female caregivers. Well, it is the family network that sacrifices a woman, although she may be a high-profile professional, but then she will have to take care and be the caregiver at home because of many reasons. Well, in that exercise, the women that had to stop working in my country because of aging, and there is a high percentage of aging, and those that could not join the labor system, that the main reserve we have is women, but in there, it affected 1% the GDP. That is, it is a problem in sustainability and valuation. And so I propose to the chair of Chile Secretariat that in the events of next year, you have the meeting, Regional Conference on Population and Development, the 10th anniversary of the Montevideo Consensus, that this be a priority subject. At the Social Development Commission here in Celade, or please, to convene a meeting to go deep into this. We need to learn what is Chile doing. That told us very briefly a while ago, and what is it that we do, each one. And this is an idea as a result of all these very valuable interventions. Thank you. Civil society now, please. Can you introduce yourself?
Good afternoon to everyone. My name is Jennifer Rose, and I'm a gerontologist by profession, and I come from the Republic of Trinidad and Tobago. As you know, we didn't have our delegation as intended, so I am the voice now for my country. I served for 15 years in the government, so having attended 3 prior conferences of regional intergovernmental, I spoke from the government bench because I was part of crafting the policy on aging. So I know it from that side. But now in retirement, I have no other choice but to look at it now from a life course perspective. And what I'm seeing is that aging has morphed from being a social issue to now being an economic issue. And as a result of which the language has changed, where the older persons now are being seen as a burden rather than as a resource. So here as an advocate and a lobbyist for the group and being a member of the group, I not only have the advantage of speaking from that professional side, but from a lived experience, because now I'm a client and a beneficiary and all of those things in between. As a result of what I'm seeing, what COVID exposed, it focused first on the vulnerability of the 60 and over. But coming towards the latter half of 2021, we were seeing now a rise in the COVID at the ICU level among the 20 to 49. Also what we saw, and this came from the epidemiologist who was on board, trying to analyze the implications of COVID, the 20 to 49 cohort who comprise the critical mass who are on the waiting list of the dialysis machine because of renal failure. That is a crisis now, and I will be as quick as possible because of time. That same 20 to 49 age group is critical mass of the workforce. That's the group who is going to generate the taxes that will go into the consolidated fund to pay pensions. If something like this is happening with them, where psychosocial implications are now looking at mental illness, because I'm speaking with them directly, because now retirement has given me the time and the space to do so. And some of them are my very nephews and nieces who are calling out for help, because they have studied professions on the supply side of the market, and there are no jobs for many of them. So the demand side is left. Forget about gerontology. I might be the only one of 3 in the country of 1.4 million people. And I believe there may be 1 geriatrician. That is a crisis by itself right there again. What I'm seeing coming through the tracks now, with the same 20 to 49, it has now made the dependency ratio flawed, because where they comprise the critical mass of the labor force that will see after the dependents being those who are now over 60 and 65 and those under 15, what we are seeing is a reversal of the dependency, where now the pensioners are now assisting them financially. Because in that 20 to 49 cohort, we have the unemployeds, the unemployables, and the underemployed. We have those who are incarcerated. We have those in drug abuse. We have homeless. The very criminals we are speaking of come from that group, because it's they that are killing some of the elderly. And we also have gangs. So recently, what the Prime Minister did was label this high spate of violence we are seeing in the society as a public health issue. And what we are also seeing, because of my taking this as a life course perspective, yes, I know what's happening in the target group of the seniors, which is the discourse here. But I'm looking further back, and I'm seeing the rise in bullying among our children. So that has to be addressed as a mental issue as well, mental health issue, and it is being looked at in that way. And then we also have a rise in the bullying not being seen in the denominational schools, which are now the more secondary level of schools, but we are looking at more psychosocial impacts, where students in what is considered the prestige schools are now thinking of suicide, they're doing cutting of themselves, and all of these based on the pressure being imposed on them from environmental shocks, because they are not getting the requisite counseling and social support that is needed, because some of these guidance counselors and all the various support systems need to be addressed. So I think in the discussion here, I needed to speak and make this point clear that now that we are dealing with the aging issue, it cannot just be just on the socio-demographic side, but has to be seen now as a life course perspective. And we have to start from the children. So in my advocacy, which still continues because I'm not retired, I'm just in retirement out of being bounded by an office. But in my advocacy drive, what I'm now doing, and I'm being invited to speak to many of the financial institutions, I am now turning now to the 20 to 49 who are employed and letting them know that it has now redounded to their personal responsibility, because the government will eventually be unsustainable with all these means tested and subsidies that are being given. They are already tracking back on letting seniors now start paying for one or two things that they never used to have to pay for before. Because as you may know, Trinidad and Tobago is an energy-based economy. So they're already feeling the shocks of oil and gas, and we are more gas than oil. So when you have to consider that so much mental illness and what is happening in the 20 to 49 age group, and as a result of not getting jobs, many of them are migrating, it means those are the potential caregivers for us. And what is going to happen? And then in that 20 to 49 are grandparents. The grandmother and grandfather now is 30 to 35. So we are now seeing multi-generational households where in one household could have 3 generations. So it is a whole conundrum that we have to look at from a very macro perspective to know how we can handle and treat with this. So I speak with the passion, as everybody who knows me at home as the aging lady, because I know I am in the group, but I have to really address the family as the unit of analysis, because we cannot just look at just all the rights of the older persons alone in exclusion to what is coming up behind, because that's the legacy that we have to deal with. Those are the ones who are going to be replacing us. Those are the ones who are going to be the leaders. And therefore, we have to see this in the context of public health. It doesn't mean that it is an absence of an illness, but they are not well. They are not well, and they are calling out for help. And it is now incumbent on some of our seniors who have the institutional memory and the experiential learning, and just having to live from our lived experience. We know what they need. We know what they need, but now it is a question now to turn the arrow around and look at this thing at a whole other level, where it is not just about throwing more money and raising the pension and giving them another grant. It is much deeper than that, and it is layered and tiered. And so I will just end briefly by saying what I have been given, the message that I have been given, the kernel of the message that I've been given to the 20 to 49, start opening, and I have done it myself, because whatever I'm talking about, I practice myself. I have to open a family indemnity plan, which I did in September for my burial, because it is so serious now that COVID has made burial services and funeral services explode. So some families cannot even claim their bodies.
Yes,
and,
thank you.
And,
thank you
and
for
that is
your
just
comments.
a little summary of what is happening. And I thank you for this space that you have allowed me for my voice to be heard.
Thanks for your comments, really. But I need to be the bad guy that push a little bit the limits of time, but vamos a seguir ahora con las palabras. Hay una palabra de sociedad civil que se ha solicitado. Por favor, yo sé que hay muchas ganas de poder comunicar las experiencias que estamos trabajando. Yo sé que hay mucho valor en las personas que están acá, sobre todo desde sociedad civil que han trabajado estos temas, pero si no, si no seguimos con los tiempos no vamos a alcanzar a ver los otros temas que tenemos para esta última sesión. Así que hay una palabra de sociedad civil, no sé si hay un micrófono que le hayan podido facilitar. Muchas gracias.
Muy buenas tardes a todos y buenas tardes, presidente de esta plenaria. Mi nombre es Aquiles Mercado Río Seco. He viajado 1000 kilómetros desde Osorno y en mi condición de presidente del Círculo de Exfuncionarios de LANChile, fundador de la Asociación por la Defensa de los Fondos Previsionales y la Seguridad Social e integrante de la Mesa Coordinadora Nacional, ¿cierto?, de Adultos Mayores que preside, digamos, nuestro gran y querido amigo Jorge Campo. Quiero plantearle una cosa como presidente de esta plenaria, integrante del gobierno, flamante ministro de Desarrollo Social, y creo que va a ser presidente de la República incluso. Lo siguiente, nosotros venimos acá con la mejor intención. Vemos también en ustedes las mejores intenciones respecto de todo aquello que se está plasmando en distintos documentos muy bonitos, digamos, los libros, ¿cierto? Muy buen papel, qué sé yo, pero en la práctica, cuando uno sale a la calle, a la realidad, y esto se lo digo con hechos concretos, nosotros los adultos mayores, que somos un universo que ya vamos casi a los 4 millones, ¿cierto?, de personas, más del 20% de la población de nuestro país. Y resulta que en la realidad uno ve esto acá, en foros internacionales, pero ¿qué ocurre? El aparato que hoy día maneja, ¿cierto?, el poder fáctico de este país, en televisión, y esto lo digo porque como exfuncionario de LANChile me correspondió vivirlo, nuestra configuración geopolítica de 2000 kilómetros hacia el norte, de 2000 kilómetros hacia el sur, ¿cierto?, hace necesario que nuestros ciudadanos tengan una información rápida y expedita. Y resulta que como en este país hemos comprobado que la gente no lee, y si lee, no entiende lo que lee, ocurre lo siguiente, que la televisión es el mecanismo claro, categórico, que de alguna manera, ¿cierto?, promueve ciertas ideas, ciertos intereses, y que son muy efectivos para los que manejan esos medios. Sin embargo, no se habla de los adultos mayores, no se promueve nada de los adultos mayores en televisión, ni siquiera en el canal nacional. Entonces, mi ponencia, que traigo, digamos, de estos distintos organismos, es que el gobierno, precisamente, tome conciencia de que el mejor medio para difundir estos acuerdos sea a través de la televisión. ¿Y por qué? Porque nuestra institucionalidad, a través de la ley, ¿cierto?, del Consejo Nacional de Televisión, la ley 18.388 en su artículo 12, ¿cierto?, letra B, dice que el Consejo Nacional de Televisión está facultado para auspiciar, promover y financiar programas de alto nivel cultural e interés nacional, regional, local y comunitario, con un sentido educativo. ¿Acaso el tema tan sensible de los adultos mayores no es un tema de alto nivel cultural e interés nacional? Yo creo que sí, y el gobierno también tiene que entender lo que es así, y no tan solo para nosotros, yo creo que para todos los países aquí presentes. La televisión hoy día es el mejor medio para promover todo tipo de beneficios, y sobre todo de nuestro sector, que es un sector altamente sensible. Y se lo pedimos, ministro, perdón, presidente, ya lo bajé de categoría, presidente, creo que esto se debe llevar a cabo, ¿cierto?, en forma consensuada, con los afectados que somos nosotros. Porque uno ve un desfile de políticos, ¿cierto?, en los matinales televisivos, ve un desfile de empresarios, ¿cierto?, que naturalmente defienden sus intereses, ve a la asociación de dueños de la AFP, entre comillas, porque los dueños somos nosotros de los fondos. O sea, nosotros somos los grandes inversionistas a nivel latinoamericano aquí en este país. Entonces, también le hablo en ese sentido. nosotros tenemos derecho. Es decir, cuando yo formé la Asociación por la Defensa de los Fondos Previsionales, se nos vinieron encima muchos poderes fácticos y algunos máficos. ¿Y qué ocurre? Que tuvimos que bajar el perfil. Entonces, por eso le digo, ministro, perdón, presidente, creo que esto debe quedar consignado, porque, como le digo, esto no puede pasar por alto. Queremos que la gente sepa, que la gente entienda. No podemos andar como trovadores de boca en boca, ¿cierto? Enviando estos mensajes.
Muchísimas gracias.
Muchas gracias y muy amable.
Muchas gracias por su intervención desde Osorno, la región de los lagos, una hermosa región del sur de nuestro país. Bueno, no hay perdón, disculpen, había olvidado la palabra que había solicitado Argentina, así que a su delegada, que me imagino estará muy interesada en lo que pase el domingo. Estamos todos acá, yo creo, expectantes del domingo.
Nosotros y nosotras también, tengo que decirlo. Así que muchas
Le damos la
gracias.
palabra.
No quiero quitar más tiempo, solamente quería retomar, quizás por defecto de mi formación de ser politóloga y que acá la compañera habló del desalojo de lo político. Hoy tuvimos, a lo largo de estas jornadas de trabajo, se ha hablado muchísimo. Me llevo, la verdad, que para Argentina, además, mucho que hemos aprendido de la exposición, tanto de la sociedad civil como de las otras delegaciones. Pero sí me parece, así como a veces repensamos al tema del capitalismo en lo que es la cultura del descarte, o que la que la compañera hablaba en términos de productividad o reproductividad, de lo que implica el colectivo de adultos mayores, no olvidarnos de eso del desalojo de lo político. Me parece fundamental. A veces cuando pensamos en términos de difundir el derecho fundamental político que es en democracia, que se ejerce, que es votar, elegir a quienes nos representan. En el caso de Argentina, por ejemplo, el voto es obligatorio entre la edad de los 18 y los 70 años, ¿no? Y cuando pensamos en las campañas institucionales para promover la votación, focalizamos en lo que hay, la normativa que se va generando para poder facilitar el acceso al voto. Lo pensamos en términos de qué pasa con el voto extranjero, con las discapacidades diferentes que se presentan, con las embarazadas, pero no promovemos nunca con las campañas que los adultos y las adultas mayores vayan, participen, que aprovechen de los distintos dispositivos que existan. Y me parece que en democracia pensar también a los adultos y a las adultas mayores ya no como objetos de la historia, sino como verdaderamente sujetos de derechos que también siguen siendo útiles hablando de la utilidad en otro sentido, ¿no? En una democracia que tiene un montón todavía de deudas sociales, muchas de las cuales retomamos acá, pero que realmente sirven para fortalecer la participación popular, que debe seguir siendo uno de los espíritus también del fortalecimiento de la democracia. Por eso celebro que también se traiga acá. Obviamente, nosotros lo vemos, las personas que viven en el casco, que son urbanas, las personas mayores que quizás tienen la posibilidad de que un hijo o una hija la lleve, de tomarse un taxi, de poder acceder. Se marca mucho la diferencia de los abuelos y abuelas de los barrios populares que por ahí no tienen un peso ni para tomarse un colectivo, que les cuesta llegar para votar, que tienen que estar pensando en qué van a comer al mediodía. Entonces, bueno, también pensar a los abuelos y abuelas como sujetos políticos y sujetos de derechos desde ese lugar. La verdad que celebro, compañera, que hayas hablado del tema del desalojo y lo político también de nuestros abuelos y abuelas y personas mayores. Muchas gracias, Chile, y muchas gracias, CEPAL, por todo este esfuerzo enorme que han hecho. Así que era eso, nada más.
Muchas gracias a la delegada representante de Argentina. Bueno, con esto concluimos esta parte del panel, el tercer panel de este encuentro, y ahora vamos a hacer un break de 10 minutos y luego vamos a proceder a avanzar en los acuerdos y la finalización también de este encuentro. Así que nos vemos en 10 acá mismo.
Buenas tardes. Les vamos a pedir, por favor, a las delegadas y delegados si pueden tomar sus ubicaciones para iniciar el tramo final de esta conferencia. Muchas gracias.
Ok, buenas tardes a todas y todos. Bueno, muchas gracias por estar en esta sesión. Corresponde en este punto del temario que los países consideren y aprueben los acuerdos correspondientes a la quinta conferencia regional intergubernamental sobre envejecimiento y derechos de las personas mayores en América Latina y el Caribe de la CEPAL. Así es que, señoras delegadas y señores delegados, hemos circulado una propuesta de resoluciones que contiene los principales acuerdos de esta reunión, que va a pasar a relatar el procedimiento de la Secretaría en relación a eso, y bueno, entiendo que la Secretaría también tiene que introducir el panel.
Muchas gracias, Presidenta. Brevemente decirles que la Secretaría ha circulado, ha distribuido el proyecto de declaración de Santiago que tienen en sus escritorios. Si no hubiera comentarios, va a ser sometida.
If there are no comments, it will be subject to approval. And also the members of, so the fifth regional Intergovernmental Conference on Aging and the Rights of Older Persons in Latin America and the Caribbean for 2022-2027, it will be with the chair of Chile, and vice chair will be Belize, Colombia, Costa Rica, Guyana, Panama, Paraguay, and Peru. In this way, it is made up. If with an applause by acclamation, we can close this procedure. The chair and vice chairs of this conference. Likewise, we can move on to adopt the draft Santiago Declaration. If nobody has requested, so we consider adopted the draft Santiago Declaration. Yes, in this way, we can say it has been adopted, the Declaration of Santiago. Thank you, Chair. And with this draft Santiago Declaration, and once the Santiago Declaration has been adopted, we move on to the closing session of this conference. With that, we have Raúl García Butaca, who has the floor now. Thank you, dear Joseph Marion, in charge of the Regional Office of UNFPA, dear Francisca Perales, Undersecretary of Social Services of the Ministry of Social Development and Family of Chile, in the capacity of chair of the 5th Regional Intergovernmental Conference on Aging and the Rights of Older Persons, ministers, delegates, representatives of the organizations of civil society, colleagues, friends of the UN system and of ECLAC. It is an enormous satisfaction for me to be accompanying you and share with you this closing session of the 5th Regional Intergovernmental Conference on Aging and the Rights of Older Persons in Latin America and the Caribbean that has provided us the opportunity to have very rich, intense debates with interesting presentations here in the room, as well as those remotely participating virtually. And I understand that we're preceded by meetings and dialogues of regional organizations of civil society. And we had 3 side events organized by the government of Chile and by the sub-regional venues of ECLAC in the Caribbean and Mexico for Central America. I would like to highlight the great importance we assign to the participation of the delegations of each and every country that have presented your report, your actions in public policies, your perspectives, the evidence, and the statistical information supporting all of this for the implementation of the Madrid International Plan of Action on Aging. Special acknowledgement to the countries that sent to the Technical Secretariat your national reports, extremely valuable and have been the basis for the preparation of the regional report that was very complete. Thanks to the panel members for your generosity, for sharing your views, your thoughts, your analysis, and to the representatives of civil society for offering your perspectives, your proposals throughout these days of work. I would like to underline that the representatives of countries have referred to the progress advances in the legislative arena, but also strengthening the institutions in charge of older persons, the need to maintain coordination of an intersectoral and interinstitutional nature was reinforced, providing greater policies for older persons. The training of professionals and staff caring directly that senior population. Recurrent mentioning these days has been the need of guaranteeing a universal coverage for social protection of older persons as a safe way to overcome inequality in the process of aging. And the focus needs and should be in empowering the seniors for the enjoyment of a full, fruitful, and inclusive life. It is likewise fundamental to move forward in healthcare, specialized promotion and prevention actions for older people. At the same time, the progress of governments in the vaccination process has been recognized, but also there is a need to have better planning that will allow to mitigate the risk of new pandemics or other diseases. And although important achievements in care systems have been reported, there is also a need for the state to be responsible for the protection of the caretakers and caregivers. The work of care should be a goal that needs to meet all the needs of the senior populations, but also an act of generational justice to those persons who have prioritized this type of work. All the countries of the region need to promote development and undertake care policies, including long-term care palliative care in order to build a society of care, as it is also pointed out in the document presented by the Technical Secretariat and also in the 15th Regional Conference on Women, that was especially about the society of care, self-care, the care of our families, our communities, but care of the planet as well. We are in that climate and environmental crisis where our subsistence and our environment is being impacted, our habitat. As it has been expressed in different sessions, a key aspect is to double all efforts and allocate resources to ensure the statistical visibility of the elderly, to strengthen statistical systems, allowing to have disaggregated data by age, by gender, by race, by disability, or any other characteristic that will give an account of this population group in all of its diversity. Now, during these days also, we have heard the voices of the regional organizations of civil society of older persons, very important, and they have shared with the government their concerns in view of the rise in economic and cultural and social inequalities and violations of human rights that older persons have experienced as a result of the health and socioeconomic crisis linked to the pandemic. Also, it was said that these inequalities were deepened as a result of the poverty situations, discrimination by age, gender, race, ethnic, and other intersectionalities, and to face them also to recognize the heterogeneity of the populations and the accumulated inequalities. Along these same lines, it was pointed out the need to continue strengthening the international protection of human rights of older persons to be strengthened at national and international regional level. Also, the digital gap was presented. It's not only access to the new communication and technologies, but also the use by older persons that very often it is a barrier that impacts on the true enjoyment of the environment. The older persons have really evidenced how the pandemic impacted them. And in this conference, once again, have committed to the defense of human rights and participation in order to continue moving forward with better public policies. Dear colleagues, delegates from the Plan of Action, International Plan of Action on Aging of Madrid, that with other tools are indispensable to promote, to drive, and strengthen the human rights of the seniors. 20 years after its adoption, the Plan of Action continues to play a unique role in the regional debate on aging and older persons. It is clear that we need to place in the center of our attention and in the center of our priorities the older persons, also with the other populations that are in disadvantaged conditions, the girls, the adolescents, indigenous peoples, Afro-descending peoples, migrants, persons with disabilities, LGBTQ plus, among others. From the Technical Secretariat, which is SELADE, we reaffirm the commitment to continue with the support to the countries for the implementation of the International Madrid Action Plan on Aging, Montevideo Consensus on Population and Development, the Charter of San Jose on the rights of older persons in Latin America and the Caribbean, and the Decade of Healthy Aging. We will continue collaborating with interagency groups on aging, and we will continue working in generation of data and updated knowledge on aging and rights of older persons with recommendations targeting public policies. Having arrived at this point to the closing of the fifth conference, this is the result of joint work between government, civil society, international agencies, and academia. This has been and will continue to be our path forward. We contributed with a very demanding and ambitious agenda, yes, but we are pleased for having adopted the Santiago Declaration, which is the result of the agreement of each and every one of you, all of you, on behalf of your countries. Declaration urges us to move forward in tasks related to promotion, protection of human rights, and fundamental freedoms of all persons, and the elimination of any kind of violence and discrimination of older persons. We underscore the crucial role of this regional conference, as the intergovernmental space for the systematic and voluntary review of the Madrid International Plan of Action on Aging, whose strategic role and full enforcement have been ratified. These states are responsible to promote and provide the necessary measures to guarantee a healthy aging with dignity and full enjoyment of the rights in the maximum level of quality of life possible. We highlight the different contributions, key contributions that older persons provide for the functioning, for the operation of our societies. And also we urge the adoption of effective measures against discrimination by age, an obstacle that still persists and undermines the participation of older persons in the political, in the social, in the economic and cultural life of our societies. And of course, it recognizes the crucial role of the organizations of civil society, of the private sector, academic sector, in the implementation, the follow-up, monitoring, evaluation processes, and accomplishment of the Madrid Plan. So it is with satisfaction that we see the very high participation. We have representations from 29 member countries, 3 associate members of ECLAC, 49 organizations of civil society, and 9 agencies, programs and funds of the system of the UN. The hybrid format enabled participation of more than 2,600 persons on Tuesday, the opening day, where 320 have done it on a face-to-face basis. And through YouTube, Facebook, Twitter, and Zoom, we had 2,300 participants. So I take this opportunity to greet all those who have followed us in the social media and are here with us as well. I cannot express my thanks to ECLAC and all those that have enabled this event. First, the Population Fund of the UN, our strategic historical partner in the implementation of the Population Development Regional Agenda, and also in the implementation of the Montevideo Consensus, International Action Plan of Madrid, and international instruments of monitoring. Also, we want to thank the outgoing chair, the Ministry of Health and Social Well-being of Paraguay, Julio Gorba, for this 5 years of intense work, and to continue promoting the plan of Madrid. The chair of Undersecretary and Minister of Social Development Ministry of Chile, that will lead the work of the conference in the next 5 years, with the countries that are vice chairs, vice presidents. And also thanks to all the governments of the region. Without your political willingness, it would have been impossible to arrive to this conference with such a significant agreement enshrined in this declaration. a recognition, acknowledgement of those civil society of older persons because of your great commitment for the rights of older persons, contributing to this debate of convergence and consensus. And also, finally, the team of ECLAC that has permitted this conference, the colleagues of the Secretariat of the Commission and of the Office of the Executive Secretariat, the teams of documents, publications, public information, this section of technology, information and communications, TICS, conference service, security, and my own office. Also, the colleagues from the regional, sub-regional offices of Input of Spain and Mexico. And of course, our thanks to all the team of the Latin American and Caribbean Center on Population, TELADE, and the director Simone Tecchini, who is the technical secretariat, for the enormous work, inexhaustible commitment, dedication that you have displayed in the organization of this conference. To thank also the interpreters of Spanish and English, and also the interpreters of sign language that always allow us to be ever more inclusive. And thank you. We continue to work for a fairer region. That is what drives us. Fair, just for all ages, and particularly for the older persons. Have a happy trip back home. Thank you very much.
Thank you so much, Raúl García Buchaca, Acting Executive Secretary, for his words. And we now go to the words by Joseph Marin, in charge of the Regional Office for Latin America and the Caribbean of the United Nations Populations Fund. Dear Mr. Raúl García Buchaca, Acting Secretary General for the Administration Analysis of the Economic Commission for Latin America and the Caribbean, ECLAC, Mrs. Francisca Perales Flores, Under Secretary of Social Service in Chile, delegates from the member governments member of ECLAC, colleagues from ECLAC and the United Nations system, representatives from civil society. Good afternoon, everyone. We are concluding 3 very intense and productive days of work. And from UNFPA, we would like to thank the government delegations, academia, international organizations, and civil society organizations for their contributions to advance in the agenda in order to cater to the aging of our population and the aging in our region. Throughout these days of very fruitful work, we have clearly seen the need to act in a joint way with synergy to improve the living conditions of the older persons and to guarantee the full enjoyment of human rights through public policies and interagency and intersectoral actions that will prioritize their well-being and their political participation. We commend ECLAC CELADE for the work conducted in the secretariat of this conference, and also for the elaboration of the regional report as a follow-up to the Madrid Plan of Action. This report is fundamental for the understanding of the population aging in Latin America and the Caribbean to guide our actions, and it constitutes a roadmap for the exchange of good practices. Simultaneously, the report warns us about the profound gaps that currently exist in our region to guarantee a dignified life to older persons and the enforcement of their rights. We need to act today to confront the structural inequalities and social discrimination that leave older persons aside, exposing them to poverty, violence, vulnerability to phenomena such as climate change, preventing the full guarantee of their rights. We visualize these days the opportunities to support initiatives that favor public policies that strengthen social security, to put their eyes on the rights of older women within the agenda of the comprehensive health of this population group, and show the importance of the comprehensive care system so as to face the gender gaps. Undoubtedly, this conference constitutes an important opportunity to harmonize efforts in national legislations for the protection of older persons, prioritizing perspectives of the rights of women, intersectoral perspective, and political participation of older persons. To that end, it is fundamental to count with the data-based evidence, as well as the strengthening of statistical systems for the generation of timely and disaggregate information that will contribute to the statistic visibility of older persons. Finally, from UNFPA, we would like to congratulate ECLAC for the organization of this important conference that will define the future of the region, which is undergoing rapid demographic change. We would also like to thank civil society of older persons who are present here for their active participation and their contributions throughout this conference. Likewise, we greet and congratulate the new chair of the conference, and we are willing to accompany the countries in their work. Finally, from the United Nations Population Fund for Latin America and the Caribbean, we reiterate our support to the governments to formulate policies and to guarantee technical assistance to the public institutions based on the current and future demographic requirements. All this with a clear conviction that contributing to the full guarantee of human rights of older persons is a must to leave no one behind. Thank you very much. We thank Joseph Marian, the Chief of the Regional Office for Latin America and the Caribbean of UNSPA, for his words. And to close this conference, the Chair, Francisca Perales, and the Secretary of Social Services and the Ministry of Social Development and Families Affairs of Chile, country that holds the chair of the 5th Regional Intergovernmental Conference on Aging and the Rights of Older Persons in Latin America and the Caribbean. Thank you very much, Jimena. Once again, salute each one of you. Thank Mr. Raul Garcia Buchaca for his presence here addressing us and for having accompanied this chair in the way that the whole team did, and extend the gratitude to all of the CLAC's units, and particularly CELADE, where with Simone, we've been talking for a couple months, and also with the CELADE team. Thank you very much. We're very happy the government of Chile to be able to chair these 5 years in the conference, and we would like to leave record that, first of all, we will receive all the pending tasks coming from the report, and at the same time, we will try to strengthen in the best possible way and put all our efforts so that the goals and the actions adopted in this conference may be met in the coming 5 years. I would also like to thank Joseph. I don't know really how to pronounce your last name. Marian? I hope it's okay. From United Nations Population Fund. Apologize because it's not very strict to the protocol, but I want to thank you for your work. Joseph commented how from ONFA they will be cooperating with to us with our role as chair at the ministry, and particularly with the minister and myself who will be leading this process. I would also like to thank the delegations who are present here. I'd like to thank the countries who will be co-chairs and to tell them we're totally available to do our work in the most collaborative way possible so that together we may face the challenges that we assume today. These are not challenges taken up only by the chair, but these are challenges for all the region and for all the countries who are participating here, with the different characteristics and hurdles that each of the countries face, which are different, but at the same time, in the case of our region, they're also very similar. Inequality, for example, is one of the factors that is cross-cutting in our continent, particularly the countries who belong to this portion of the continent. And to leave record that we will adopt all the necessary measures so that the follow-up can be the very best as possible and that we may continue to work together. I would also like to thank the civil society organizations. In Chile, we call them social organizations. I want to thank them specifically and to leave clear that from the administration led by President Boric, we believe that the articulation of institutionality with the social organizations, with the civil society organizations, and with the social movements as well, are very relevant for the generation of an articulation that will guarantee dignity, guarantee well-being, guarantee to be able to change the relationships of power that the governments have had with those organizations and with society as a whole. Working together necessarily implies achieving those levels of well-being. That is something the president has entrusted all of us who work in this government to permanently work at it with the social organizations related to this area. So we, from our ministry, we will have to articulate with you in the goals of this conference. Our willingness then is clearly stated regarding what you said yesterday after the national reports. Finally, I believe that in terms of the content, Raul and Joseph addressed the agreement very well, the relevant topics that were dealt with here. We have structural challenges such as social protection for older persons with the perspective of rights that cross a series of levels, not just the mechanisms of overcoming vulnerabilities, but also from other angles in our societies. Comprehensive health and how we adapt ourselves to the shocks and challenges that have been taking place. On the one hand, we have climate issues, but the pandemic also shows us that we must promote the rights to health of older persons, not just palliative care when there is a disease or when there is a dependency, but rather how can we ensure that the lives of persons are as active as possible and that they may have at the same time the possibility of enjoying life during old age. And that is very important and something that from Chile we have addressed very often. And so that's the intent of our pensions reform, because in Chile we talk about pensions with the concept of retirement, and retirement comes from the word jubilus. And the pensions that our people get give them no joy. So it's a game of words and play on words in Spanish. The idea is to look for the happiness of persons, and we're very clear that we will continue to work to that end. And I'm leaving some things, I'm not touching on certain things because certainly I agree with everything that we have addressed, talking about the how cross-cutting the different needs in our society are. They're not necessarily homogeneous. And advance to society of care, which is a definition that ECLAC itself has adopted. I participated from the Chilean delegation, the 15th Conference on Women in Buenos Aires in November, and we approached this same topic, but from a different perspective, from a gender perspective, on account of the role that women play in household duties and care in our societies. But they also pose challenges as to how we ensure that there is a society of care for old persons that will allow them to have a dignified aging process. So from this administration, we're totally committed to it, and it's part of our government program, as you heard Minister Jackson say a couple hours ago when he spoke of our proposal being carried forward by the government of Chile, which is something we started on March 11 this year. Just to highlight that our intention will continue to be to strengthen actions. We're totally available to continue to work, and I hope that we will keep in touch to start working as soon as possible, given the time available for each one of you. That would be it on my part. Thank you very much. And I believe that the work articulated amongst all of us has been very fruitful in this conference. Thank you very much.
Muchas gracias.
Thank you very much, Undersecretary Francisca Perales, on behalf of the chair of the conference. This way, we officially adjourn our conference. Good afternoon, and thank you very much.